Hello everyone. Hope you're all doing okay. Hope the stream is live. Give me a second just to ensure that if you can hear me, say hello to me or just write yes so that I know that it's okay to start. If you're watching this video at a later date and I know you are preparing for your profs then or you just want to know about this topic. So I have two advices for you. One, watch the entire video, right? And second, so you can skip the initial part, right? You are familiar with the basic things. And second thing, while we do the MCQs, since I'm doing this as a YouTube live session, I'll be pausing in between to ensure that the MCQs are asked in a proper way. Right? So you can skip through those pauses if you are able to answer the MCQ at the moment I show it on the screen. You can skip through that part. So that is my advice for the people who are watching later. So we are going to be covering beautiful topic today and let's begin in just a minute. So the topic we're covering is the blood supply of the head and the neck and the spinal cord and the brain. So we are covering literally everything related to the head and neck, the brain, to both the neuroanatomy portion and as well as the gross anatomy portion of the blood supply, right? So if you look at the blood supply of the head and neck, you have to start from the neck, where you'll have the subclavian system and you have the carotid system, which gives most of the branches to the head and the neck, right? And then besides that, when you talk about the blood supply to the brain, right, you have your circle of Willis. This is one of the most important topics, and it is also my favorite topic in the teaching manner. So I hope you like this overall presentation and the overall content. So let's start. Welcome to Let's Crack NEET PG, the YouTube channel of Unacademy NEET PG division, where you'll have the top educators, the quality content that is uh, very authentic, right? And you will see the quality of the content in my presentation as well today. And it is going to be a great learning experience, I assure you that. So, if you are wondering who I am, my name is Chetanya Mittal. I am a third semester MBBS student at All India Institute of Medical Sciences, Delhi, and All India rank 4 in the AIMS examination, All India rank 5 in the JIPMER examination, and All India rank 261 in the NEET UG examination. So we are going to be talking about the blood supply of head and neck. And since I was covering this, I also decided to give you in a single video the blood supply of the brain, and I'm going to touch upon the blood supply of the spinal cord and the internal capsule as well. Okay. So this is our main topic for today, and that is one of the most important topics. It will make most of your vivas and along with cranial nerves. So if you are able to do cranial nerves and if you are able to do the blood vessels, so this will form approximately 50% of your entire head and neck anatomy. Besides that, you will have most of the regional anatomy, and we've covered the nasal cavity and the pharynx, which I feel are central to understanding. We've also done the orbit, so I feel that's central to understanding the head and neck. Let me tell you a little bit about Unacademy NEET PG first, right? And if you are watching this video on a later date and you know about all this, to this part. So first thing is that there are a lot of structured courses available on Unacademy. Okay, and ye sub hai plus courses. So you can see that all these courses are locked if you open them right now, and you can see that a lot of experienced educators are taking structured batch courses there. Okay, preclinical, paraclinical, and even clinical subjects. Okay. Then second thing is that you have special classes. So even if you are not planning to take the NEET PG subscription, I will say that you download the Unacademy Learning app because there are a lot of free classes that are done for all the educators. Okay? And a lot of things are discussed there. So you can definitely go through this as well. You can attempt mock tests, some are free and some are included. So like this is a free mock test and this is included with plus where you will be having a weekly mock test for NEET PG 2020. Okay? Then why Unacademy? Because any why online learning platforms basically, because you have the option of having a flexible schedule. You can learn in the language of your choice. I can speak English. मैं हिंदी में भी बात कर सकता हूँ उतना ही फ्लुएंटली. कुछ नहीं समझ आता है just write it down in chat. Unlimited practice कर सकते हैं. You can just chat with me like you're in a live class. Interactive way में करेंगे and I'll be asking you the answer. तो fun होगा बहुत and you can learn anywhere. ठीक है, मेट्रो में बैठे हो तो भी सीख लो. Just download the app, install it, and then go to the NEET PG subscription. So I would recommend you take the 36-month subscription. This is not given here. I'll come to that. And all you have to do is there's an option to enter referral code. Please enter my referral code there, Chetanya10, right? So if you enter this, you get a straight 10% off, and you also get another 10% off if you have enough credits. Okay, so these are the option to apply credits. So I've now told you a way to get 20% off with my referral code. And please do use my referral code. And what is the advantage to you for using my referral code? I'll just contact me. I'll assure you that you get some extra, right? So then this is about the whole plan, and then you have to see basically after you apply this, you'll straight away get the discount, and if you make the payment, you'll get an option to do it either via EMI or via card. And then the thing I wanted to talk to you about, especially for NEET PG, is the Iconic subscription. Now, what is the advantage of the Iconic subscription? That you get Unacademy Plus, right? Where you have everything I just told you. It is India's largest online learning platform already. Plus, you might have heard of Prep Ladder, right? Where a lot of experienced faculties like GRG and all, they are teaching. And so GRG sir teaches for pharmacology. It's something I personally am going to watch. So for the 3-year plan, it will cost you somewhere around 2300 per month, where you are getting both Unacademy Plus and Prep Ladder. Total cost is 82,800 for 3 years. That used to be the cost of a classroom learning program for 1 year for your NEET UG. That is why, and that is you are here already been given a almost 10,000 rupee discount with my referral code. You can make it more with your own learning credits, and I will definitely give you a some sort of perk out of this if you use my referral code. Let me know. Okay, so now this is where the video actually starts. So we are at video starts at, I'll just write it down. Video starts at are you all ready to be doing the blood supply of the head and neck? So blood supply of the head and neck. So why I've drawn these two lines is I've just shown you the arteries and the veins. And my main focus, guys, my main focus is going to be on the arterial circulation. I'm not going into much detail about the entire venous circuit, right? Because otherwise it would become a too lengthy class. So I'll give you a general idea of the arterial circulation. And once you understand that, you'll be able to understand the venous ones. The venous circulation basically has the subclavian and the whole brachiocephalic tree, and then you also need to know about the azygous venous system, the hemiazygous, and all of that. So all of those are important as well. But for today, we are going to be focusing on the arteries part, the one that is more frequently asked or more frequently discussed. So I'll just change the color if you guys will be okay with that. So there are two systems of supply when it comes to the head and neck. All right. So whenever you have to start studying a topic, you have to see what is the gross idea of that topic. So what are the two systems that supply the head and neck? One is the subclavian system, right? Subclavian coming from below the clavicle. Second, you have the carotid system, where you will have the common carotid artery and the common carotid artery, which further bifurcates into the left and right common uh, external and internal carotid arteries. So I hope you are aware of from where does the left subclavian artery come, from where does the right subclavian artery come, and then you have a so basically on the right side you have a common brachiocephalic trunk, which further divides into the subclavian and the carotids, whereas on the left side you have a separate thing. So I aware that you are aware of those basics. So I am assuming that you are aware of those basics. So first we'll start with the carotid system, then we'll move to the subclavian system. Carotid system, we're going very systematically, alright? So if I tell you a little bit about today's lectures flow, it's going to be something like this. You can skip wherever you want, in whatever manner you want. The carotid system, we are going to be discussing first, where we'll first do the external carotid artery, then we'll be doing the internal carotid artery, and then we'll be doing subclavian artery, and then we'll be doing the MCQs for this, right? So that is the first part of today's lesson. Second part of today's lesson is the blood supply of the brain. We'll be doing the vertebral artery, and I'll also talk a little bit about all the rest of the arteries. Then we'll talk mainly about the circle of Willis, and then we'll be doing neuroanatomy MCQs from this topic, and then I'll give you some additional. That is the flow of today's lesson. So it's a, like you can see, it's a very structured plan that I have for all of you. so you don't have to worry about anything. So let's start with internal carotid artery and external carotid artery. First, we are going to start with the external carotid artery. Now, can you tell me what is this thing that I have drawn in yellow? What is this thing that I have made yellow in the background? So this is essentially what is known as the carotid triangle. This is what is known as the carotid triangle. Now, as you know that your head and neck has a lot of triangles. There's a posterior triangle, there's an anterior triangle. Anterior triangle is further divided into the digastric triangle, the carotid triangle, and the submental triangle. So there are submental triangle is basically half the submental triangle, and then there is a muscular triangle here, which a lot of people don't. So on one side you have 3.5 triangles. On the other side you have 3.5. Total you have 7 triangles anteriorly and 2 triangles posteriorly. You have a total of 9 triangles in your. What are the 9 triangles? 2 posterior triangles, 2 carotid triangles, 2 muscular triangles, 2 digastric triangles, and 1 complete submental triangle. That is the first concept about the triangles of the head and neck. Right? Now we'll move to the carotid triangle straight away. Carotid triangle basically is the region where you will have the common carotid artery going. It will bifurcate, it will give its, right? So if you trace this artery that is coming from below, that is here the common carotid, then it goes upwards and then it bifurcates at this level. Now what is this level going to be? This bifurcation usually occurs at the superior border of the thyroid cartilage, that is the level of C3 C4. Alright, C3 C4, superior border of thyroid cartilage. And when this divides, it will divide into its 2 branches. You all are aware, the first branch is the external carotid artery, second branch is the internal carotid artery. Now as you can see, I have not drawn the internal carotid artery completely. Why? Because the internal carotid artery is not giving any branches in the neck region. So this carotid triangle is present in the neck. So we are not focusing on the internal carotid artery. And the internal carotid artery and the common carotid artery, they are present in what is known as the carotid sheath, where they are accompanied by the internal jugular vein and the vagus nerve, and they have some relations anterior and posterior to them. Right? So let's start with the external carotid artery. The external carotid artery, first of all, the first thing that you must know is that what is the first branch of the external carotid artery? What is the first branch of the external carotid artery? By the way, all these notes are I'll be sending on my Telegram channel, that is at the rate NEET PG Chetanya, right? And you can take the notes from here instead of noting down everything that I'm saying or taking screenshots. You can definitely join my Telegram channel where I keep putting all of this stuff and I'll keep updating you about the next sessions. So we are going to be doing an MCQ marathon of the head and neck, the next thing. Right? So because we are done with the cranial nerves, we'll be done with the blood supply, and that is all the basics that you need. So if I go upwards, you have the external carotid artery, whose first branch, what is the first branch of the external carotid artery? Is the superior thyroid artery, alright, and it will obviously go to the upper part and supply the thyroid gland. Then after that, the next branch that you see is a medial branch. So you cannot appreciate it in the triangle. Why? Because it is going inward, and that is the ascending pharyngeal artery, which ascends over the superior constrictor and enters there. So this is the ascending pharyngeal artery, which is a medial branch. Important to remember this, that it is the only medial branch of the external carotid artery. What is the only medial branch of the external carotid artery? That is the ascending pharyngeal. Now if I go further upwards, you will see that there are 2 arteries going posteriorly and there are 2 arteries going. One is the facial artery. So first you'll have the lingual artery coming out, then you'll have the facial artery coming out. And why have I drawn this facial artery sort of like this? Because facial artery is tortuous in its course. Why is it tortuous in its course? Because it is present in the face where you'll have a lot of movements because of the facial expressions, so that it does not get constricted or it does not get blocked because of this. That is why the facial artery is tortuous. And then you have the lingual artery below that. So these are all the branches that are present in the carotid triangle. Alright, so you can make that out. And when you write the contents of the carotid triangle, so you can write all these arteries. So right, so what all will you write? You will write the common carotid artery, you write the bifurcation of the common carotid artery, you write the carotid sinus, you write the carotid body, you write the internal carotid artery, you write the external carotid artery, You'll write these branches: superior thyroid, ascending pharyngeal, occipital artery, facial artery, and lingual artery, right? You will write all this when you write the contents of the carotid triangle, and that is also covered now. Now, after the carotid triangle is moved on, so you will have another branch known as the posterior auricular artery. कौन है यार? क्लास ले रहा हूँ, बता कुछ अर्जेंट है क्या है? फिनाइल नहीं है यार ब्रो. Oh, sorry, that was my batchmate who was talking at my door. And yeah, so what do you have? You have the occipital artery going from behind, and you have the posterior auricular artery going in. Now, tell me one thing, that what is the structure? So, okay, uh, let's first talk a little bit about the terminal branches, and then I'll come back to the point I was making. So, when this artery ascends upward, it gives two branches, right? That are the terminal branches. So, these are the two terminal branches. What are the terminal branches of the external carotid artery? The maxillary and the superficial. Remember, you do not have a mandibular artery. You have a mandibular nerve, you have a mandibular division of trigeminal, but you don't have a mandibular artery. So the maxillary artery takes over that function. So to remember the maxillary artery, if you are very familiar with the maxillary nerve and the mandibular nerve, you'll be very easily able to correlate and remember these. The terminal branches, one is the smaller one is the superficial temporal going upward here, right, and the maxillary artery going horizontally, and a branch goes posteriorly, that is the posterior auricular. Now, what is the structure separating the posterior auricular and the occipital artery? You will have to write the mastoid process. You will have to write the mastoid. Now, what is the mastoid process? It is a surface landmark. You can see, right? There is something like mastoid. Now, anterior to the mastoid process, you have the posterior auricular artery going, and posterior to the mastoid process, you will have the occipital artery going. So that is a important point, that the mastoid process separates the posterior auricular artery. कौन है यार? मैं क्लास ले रहा हूँ, कुछ अर्जेंट है क्या? है टेक्स्ट चेक कर. So you will have the posterior auricular arteries and the occipital arteries. In between them, you will have the mastoid process. In between them, you will have the mastoid process. What separates the posterior auricular artery from the occipital artery? That will be your mastoid process. That is a orientation of the wheel. I'm sorry about the disturbance. Somebody knocked at my door, so because of that, I had to answer. I really apologize for that. That is happens when you stay in a hostel. So now you have four ways of this, right? So you have some anterior branches, you have some posterior branches, you have some medial branches, and you have some branches. That is how you memorize branches. Okay? So if somebody asks you what are the branches of external carotid artery, there should be two things that come into your head. First, that there are 8 branches. First thing that should come into your head is that there are 8 branches that you have to name. Okay. Now start with the terminal arteries. So you know the terminal arteries, they are the maxillary artery and the superficial temporal artery. So where we'll be doing the maxillary artery in detail, not worry about that. Then you think about the anterior, medial and posterior branches. So you know, now first thing you have to answer, first tell the terminal branches. Second, tell the medial branches, which is the only branch that was going medially, ascending arteries. Again, easy to remember. Again, easy to. Then think about the posterior branches, and when you think about the posterior branches, think about the mastoid process, which is the one that separates them. Anterior to the mastoid process, posterior auricular artery, because this is the auricle, so it has to go posterior to the auricle, right? From here, posterior auricular. The posterior auricular artery, and what is the one that is going posterior to the mastoid process? The occipital artery, right? These are the two arteries which are present posteriorly, and if you think about the mastoid process, you'll be able to remember. Now the third thing that you have to tell here is the medial ho gaya, posterior ho gaya, anterior. So 3 branches are left. Now you know anteriorly I have shown you that there is a tortuous artery going, that is the facial artery. Below that, lingual artery. And what is left? The first branch of the external carotid artery, that is the superior thyroid. You remember the first branch, you remember a tortuous artery, you remember that there is an artery in between them, that is the lingual. So that is how you can easily name all the 8 branches of the external carotid artery. Right? Now let's move to the maxillary artery. Fine. Is everything clear up till here? The 4 or 5 people who are watching live right now. If you guys like this video or if you think that this is going well, please hit a thumbs up, right? That would mean a lot to me. Press the like button on the video or give me a yes if you were able to understand everything in the chat. For one of you to write yes or no, if there's any doubt. Okay, so Vidushu Agrawal has given me a thumbs up. So we're good to go. Now, next we will talk about the maxillary artery. Next, we'll be talking about the maxillary artery, right? So, a reminder to everyone who is watching this video on a later date. So, I just told you a sequence. We are going to be doing the carotid system first, then we are going to be doing the subclavian system, then we are going to move to the cues, and then we'll move to the blood vessels of the brain, and that is the circle of Phyllis. Okay. So now let's talk about the maxillary artery. Maxillary artery, you have the first, second, and third parts. The first part is the part that is related to the mandible. Okay. So here the key muscle. What is the key muscle here? The key muscle means that a muscle that is used for identifying various landmarks. Or it is used to commonly divide arteries into the first, second, and third parts. Right? Like pectoralis minor, right? It divides the axillary artery into its three parts. Then you have the Calenus anterior, which divides the subclavian artery into three. Then you have the lateral pterygoid, which is again dividing the maxillary artery into three. What is the part proximal to the lateral pterygoid? It is the part related to the mandible. So that is the first part. Second part is present related to the lateral pterygoid in the proximity of the lateral pterygoid. And the third part is present in the pterygomaxillary fissure related to the pterygoid process and the palatine bone. Right? These are the three parts. Now, what are the branches of these three parts? We will just go into that. But what is important for you to remember that the external carotid artery had 8 branches. Out of those 8 branches, one was maxillary. But maxillary artery, even though it is a subdivision of the external carotid artery, beta बाप से भी तेज. That is the case here. Beta is maxillary artery and बाप is external carotid artery. But beta बाप से भी तेज मतलब maxillary artery has a huge number of branches, and that is double of what its parent artery has. So it has 16 branches. It has 16 branches, right? बटा बाप से भी तेज. ठीक है. एक्सटर्नल कैरोटिड आर्टरी की 8 है, मैक्सिलरी की 16 है, 15 से 16 होती है. Now the first part. Now let's talk about. अच्छा तो अलग डायग्राम में चलते हैं. Let's go to the first part of the maxillary artery. So I split that diagram into 3 according to the branches. The first part you will have a few branches. That is, you can see that this. What is this artery coming up? Carotid artery. What is this artery going into the superficial? What is this artery going here? This is the maxillary artery. Alright, so I'll just change to a point. This is, as you can see, is the maxillary artery. Now, what are the branches that will come? Now, the mnemonic to remember that, the mnemonic to remember all these branches is very simple. Is Admi. Okay. So what I usually do here is I in my mind I call this as the Pehla Admi. Okay. Pehla Admi. Pehla means first, Admi means man. Right. So your maxillary arteries first part. Pehla is the first part and Admi is the mnemonic. Right. So AADMI. Those are the branches that will come out. The first branch to come out is the deep auricular artery. Right here. Then you have the anterior tympanic artery. Then you have two arteries here. One is the middle meningeal and the second is the accessory meningeal. Middle meningeal arteries and the accessory meningeal artery. So you have to remember that both of these are direct branches of the maxillary artery. And finally, you will have this artery going down, entering into the mandible. That is your superior alveolar artery, which further divides into two arteries. One is the mylohyoid artery, and second you have the main trunk continuing, which gives a lingual branch, which gives incisive branch, and it continues out of the mental foramen as the mental artery. All right. So that is the entire course here that you need to know about. ठीक है. तो ये सब जो हो गया वो सब हमारा first part of maxillary artery से related है. Now what is important to remember here is, इससे तुम्हारी एक अच्छी orientation बनेगी. What are the contents of foramen ovale and what are the contents of foramen spinosum? We talked about this, right? Foramen ovale में what is the A? A is the accessory meningeal artery, right? And in the foramen spinosum, what are the contents? MEN, right? Men, male men or ovale men. Okay? And M there here is middle meningeal artery. You can see that these arteries go upwards, and this is entering into the foramen ovale, and this is entering into the foramen spinosum, right? Which is just behind the foramen ovale. So now it makes it easier to remember that what goes through foramen ovale, what goes through foramen spinosum. You remember foramen ovale, what was coming down? The mandibular nerve, which was giving a recurrent branch which is going into the spinosum known as the nervus spinous. Yeah, so that is the entire concept of the first part, the foramens, the arteries here, right? Now let's move to the second part. The second part is the part that is related to the lateral pterygoid, and that I like to call it the muscular part. I like to call it the muscular part, right? Like you have a muscular triangle. Let's call it the muscular part of the maxillary artery. Why? Because all the arteries it gives, they go to some. Now the first artery that we will talk about is the masseteric artery. So this is the masseteric artery. Second, it gives two deep temporal arteries, which will go upwards and supply the temporalis fibers. Then it gives a branch that goes downwards, that is known as the buccal artery, right? So it gives a masseteric artery, it gives a buccal artery, then it gives two deep temporal arteries, and it can also give artery to, it also gives the artery to the medial and the lateral pterygoid. We'll obviously give it to the lateral pterygoid because it is so closely related to it, and the medial pterygoid is also close by, so it will also receive a branch from the second part of the maxillary artery, also known as the muscular part of the maxillary artery. How many branches have we done so far? If you consider these as 5 branches, so you can do that, or I prefer to consider these as 6 branches, since this fourth, you have two deep temporal. So how many arteries do you have so far? 5 in Admi and 6 here in the muscular part. Just think of the muscles of mastication: masseter, medial pterygoid, lateral pterygoid, temporalis. And there is one more, the buccal artery. So you know the buccinator is an accessory muscle of mastication, right? It helps to keep the food in the mouth while you are chewing it. So these are all the arteries. So the second part, think about muscular mastication artery. Let's call it the second part. Just to memorize very easily, let's call it the muscular mastication. Okay, that is the funda behind the second. You are done with 11 branches. Now let's move to these branches. So 11 plus, you'll have 1, 2, 3, 4, 5, 6, 6 branches, right? From the third. You have around, like I said, 17 branches. If you consider the deep temporals as one branch, you'll have 16 branches, which is double the number of branches that external carotid artery, right? Now the third part, it is a little difficult to remember its branches. So here we'll have to use a mnemonic of sorts. Mnemonic to kya hai? I read this from BD Chaurasya. BD Chaurasya, there was a sequence in which these were written. Okay, and I have just put that sequence as its first letters. And coincidentally, it is something that is easy for me to remember, might or might not be for you. It's called pig pass. Alright, pig pass. Now, it's not an actual word, but it's just a funny way of saying it. And that sometimes helps you remember stuff, right? It has PIG. First branch that comes is the posterior superior alveolar artery. Now, I hope you remember that the maxillary nerve was also giving a nerve similar to this one, right? And then you remember the maxillary nerve, it went into the infraorbital groove, then it went into the infraorbital canal, came out as the infraorbital nerve. Same for the artery, it comes out as the infraorbital artery from the orbital and accompanying the infraorbital nerve. So this is the terminal part of the maxillary artery. Now, while it is going inside and it is related to the palatine bone, so it gives the greater palatine artery, divides into the lesser palatine arteries. By itself, 2 lesser palatine arteries are there, and 2 lesser palatine nerves are also there. Now, what arteries are left? This is PIG. Now, what is PAS? So in PAS, you have to remember that it will give a pharyngeal artery. Now, remember that there was an artery called as the ascending pharyngeal artery. Now, who was giving the ascending pharyngeal artery? The external carotid artery. Who's giving the pharyngeal artery? It is the third part of the maxillary artery, right? Big pass. And A is artery to the pterygoid canal, and S is sphenopalatine artery, which is the largest branch of the maxillary artery, the sphenopalatine artery. Now it is. Let's talk a little bit about the sphenopalatine artery. I hope you know it enters the nose by the sphenopalatine foramen. We talked about this in the lecture on nose. Uh, Sphenopalatine artery. What is the thing to know about the sphenopalatine artery? First, that it is the largest branch of the axillary artery given in the pterygopalatine fossa. Largest branch of the maxillary artery. The second thing that you need to know is that it enters the nose by the sphenopalatine foramen. It enters the lateral wall of the nose by sphenopalatine foramen. It has a foramen to its own name that is present between the nasal cavities. That is present going into the nasal cavity. Right. So next thing that you need to know is that it is known as the artery of epistaxis. Known as the artery of epistaxis. Now, what does artery of epistaxis mean? Epistaxis refers to nosebleed. So, since it supplies such a major portion of your nose, if there is any injury to this artery, you will have a severe, massive nosebleed, and that is why it is known as the artery of epistaxis. That is why sometimes, if you have a very severe nosebleed, you will have to ligate the maxillary artery because this is the largest branch of the maxillary, right? So now coming back to this, so just quickly let's revise what are all the branches. What are all the branches of the external carotid artery that we have talked about? So before I go into the facial artery, let's do the facial artery also first. Let's do the facial artery first, and then we'll combinedly summarize everything. Okay, and that summary is fucking important, very important, right? So this is the facial artery. Facial artery has two parts. Okay, facial artery starts here in the carotid triangle. So that is known as the cervical part. See here. Then it goes inward and emerges at the antero-inferior angle of the masseter. Can't stress how important this point is. Antero-inferior angle of the masseter, where you tap and you also get the jaw jerk reflex. Antero-inferior angle of the masseter. That is why it is also known as the anesthetist artery. Now I hope you can tell me why it is known as the anesthetist. Somebody please tell me in the chat box that do you know why facial artery is known as the anesthetic? Why not the radial artery? You can feel the pulse here also, right? So why does facial artery have to be called the artery of the anesthetist? है ना? So that is an important question now because and a lot of people don't know the answer to this. So facial artery is divided into two parts, the cervical and the facial part. Right? So we'll talk first about the cervical part. Mnemonic for that is tag. Alright. Again, it's not a mnemonic I made, it's the sequence in which the arteries are given in teacher sir's textbook of. Okay. So this is the submental artery, the tonsillar artery, the ascending palatine artery, now the glandular artery to the submandibular. These are all the branches that are there by the cervical parts. Submental artery going here, tonsillar artery, alright. Then you will have the ascending palatine, then you will have the one to the submandibular. So you have four arteries here that are given by the cervical part. And the facial part, we'll go into the details of the facial part here. So you can see that this tortuous artery, that is the facial artery. You can see it divides here into the inferior labial. Inferior labial gives a septal branch to the nose, continues as the angular artery, giving a lateral nasal artery, and forms an anastomosis here. With the dorsal nasal artery. Now the dorsal nasal artery is a branch of the internal carotid. And it forms an anastomosis. The angular artery forms an anastomosis with the dorsal nasal. Now you will think that why am I stressing on this anastomosis? Because the angular artery is from the circulation of external carotid artery. The dorsal nasal artery is from the circulation of the internal carotid artery. Why? Because the ophthalmic artery is a branch of the internal carotid. So this is a point of anastomosis between the external and the internal carotid. Besides that, you can see that we've covered more or less all the branches of the external carotid in a way, and we have also done the maxillary and the facial arteries in detail. If I take a black screen, now this is going to be a beautiful summary. Let's talk first about the external carotid. Now, external carotid artery, you have to draw. What do you draw? You draw the carotid triangle, and that is how you memorize. You have to remember that it has 8 branches. Now, how do you write these 8 branches? You write the anterior, you write medial, you write posterior, then you write. First thing that should come to your mind is what are the terminal branches? You know the terminal branches are the maxillary artery and the superficial temporal artery. Then you should think about the medial artery. There is only one, that is the ascending pharyngeal. Then you have to think about the posterior arteries. When you think about the posterior arteries, think about the mastoid foramen, the mastoid process, which separates the posterior auricular artery and it separates it from the occipital, right? What is left is the anterior artery. So you have to think of the first branch, that is the superior thyroid artery. Then you have to think about the tortuous one, that is the facial artery, and it is in between the lingual artery. That is how you write down the 8 branches like a boss. All right. Second thing that you should know is 2 arteries. We have to cover the maxillary artery and the facial artery. These are the 2 main important ones. Maxillary artery, you should remember that beta baap se bhi tez. So external carotid artery gives 8 branches, so this will give double the number of branches. Give 16 branches. Now, what are the 16 branches that it gives? Now, we'll divide it into the first, second, and first part. Is the part that is giving arteries, which is where you have the mnemonic Pehla Admi. Alright, you have the mnemonic Pehla Admi, where Pehla is for the first part, Admi is for the arteries, where you know that you have the deep tympanic artery, the auricular artery, then you have the inferior alveolar artery, and the inferior alveolar artery divides into the mylohyoid artery. I hope you remember this diagram. Yeah, it divides into here the mylohyoid artery, and it divides into gives the incisive branches, gives the lingual branch, and then continues outside as the mental artery. Yeah, so these were the branches: anterior tympanic, accessory meningeal, middle meningeal, and inferior alveolar. So yeah, coming back here, remember that. Oh, okay, that screen is gone. No matters, we'll just write it again. So the arteries were, so we talked about the external carotid artery. I already told you that. Now maxillary artery, I said you will do the first, the second. So the first you will write Pehla Admi. You will write down all the names. A, A, B, accessory meningeal, middle meningeal, inferior alveolar, auricular, and then this thing. Second is you will have the second part is the muscular branch. Muscular mastication artery. Muscular mastication. Here you will have another, that is a total of 2 deep temporals and otherwise 5 branches. Medial pterygoid, lateral pterygoid, masseter, and one the buccinator. The third part you will have to do PIG, PAS. Remember the pharyngeal. Here you will have the pharyngeal artery. So the ascending pharyngeal is a branch of the external carotid artery, and the pharyngeal artery is the third part of the maxillary. Now, after the maxillary artery is done, you will have to move on to the facial artery. Facial artery, you have to remember that it is divided into two: the cervical part and the facial part. Now, what are the main branches of the facial part? Facial part, you have the first branch that comes out, the inferior labial. Then you have the superior labial. Then it continues as the angular artery, which gives a lateral nasal branch. So, and the angular artery anastomoses, it anastomoses the dorsal nasal branch, the branch of the internal carotid. So this is an anastomosis between the external carotid artery and internal carotid artery. Important. Now, cervical branches, I already told you a mnemonic STAG, where G was the glandular branch to the submandibular gland, submental branch, tonsillar branch, and artery 2 is A. Remember, ascending palatine, right? So now you are done with all. So we have covered essentially the entire thing. Again, let's from the top. External carotid artery, how to remember? Right, anterior, median branches, posterior branches, and right terminal branches. How many branches you have to write? 8. How do you do the maxillary arteries? You divide it into the first, second, and third part. where you write that the first part is Pehla Aadmi, second part is going to be the muscular part, that is muscular artery of mastication. Third part is going to be your pass, and facial artery you will know that you have to write 4 branches for cervical, is your stag, where G is your glandular, mental, tonsillar, and ascending. 4 are your facial branches, which has the terminal branches, the angular artery, right? So you will have the superior labial, angular artery, and you have the lateral nasal artery, angular anastomosis. So this is all, right? So this is 8 branches again. So 16, 8, 16, 8. ठीक है, तो मस्त मजा बांध के रख दिया इस बात में हमने, and this is the entire summary of how you the external canal. If you liked what we have done so far, give me a thumbs up. I need a thumbs up from you all right now to let me know that I can proceed with the venous drainage. I can proceed with the venous drainage of the face. Then we move to the internal carotid artery. Anybody give me a thumbs up here? Okay, I'm glad, Jitesh. I hope you are able to understand and you like everything I'm doing so far. Now let's talk a little bit about the venous drainage. Although I've already discussed that in the chapter scalp, temple, and face that we have done as the first video. So there are two important things I want you to remember is that okay, first you should know that this is the first is the supratrochlear vein, second is the supraparietal vein. They join and they form the facial vein, right? Facial vein, then what happens here? This is your retromandibular vein in the substance of the parotid. Gives a branch that goes as ahead as the, so this is the maxillary vein, and then together they form the retromandibular vein. Sorry, this was the superficial temporal vein, the seventh one, right? So this was the superficial temporal vein, the maxillary vein. Together they form the retromandibular vein that is present in the substance of the parotid gland. Then this divides into the anterior and posterior divisions. The anterior division goes with the facial vein and forms the common facial vein. Posterior division goes and joins with the posterior auricular vein to form the external jugular vein, which drains into the subclavian vein. Whereas this vein that was formed, that is the common facial vein, will drain into the internal jugular. Posteriorly, you will have the occipital vein, which drains into the vertebral. Now, what is important here is this connection. Now, what is this connection that has been drawn? This is known as the cavernous sinus. This is the cavernous sinus, which is a very important structure inside your head and neck. Cavernous. Now, what is this? This is the pterygoid plexus. So, pterygoid. Now, why is this the whole thing important? Why? Because the pterygoid plexus gives a vein here, which is known as the deep facial vein, which is known as the deep facial vein. And which vein is this? Going through the eye. This is obviously the ophthalmic vein. Ophthalmic is superior ophthalmic vein, right? And both of these are emissary veins. Now, what is an emissary vein? An emissary vein is a vein which can carry an infection from an extracranial space to an intracranial space. So, superior ophthalmic vein and the deep facial vein, as you can see, superior ophthalmic vein is directly going to the cavernous sinus from outside. And this vein goes to the pterygoid plexus and then via the deep facial vein, and then it enters the cavernous sinus through this connection. So that is why these are emissary veins, and they are important because they can carry infections. And because of this connection, you have this area known as the danger area of the face. Known as the danger area of the face. Now we are going to move to the external, we are done with the external carotid system. We are going to move to the internal carotid artery, and that will conclude our carotid system of supply to head and neck. Right? I will start in by today itself. I expect you all give your next 2 hours to me. Okay? Don't worry, I am not 100%. I'm not going to be wasting your time. Okay? These 2 hours will be your most effective hours of study. Least for your profs, for your PG prep, and for your vivas, for your assessment. You all keep watching. I'll have active. I can move on with the questions relatively faster. So let's start with the internal carotid artery. So here, first thing is that you have a cervical part. Okay, so internal carotid artery is divided into four parts. These four parts, as you can make out from their names itself, the first part is known as the cervical part, which will be present in your neck. At the level of bifurcation is C3, C4. The cervical part, it does not give any branches. No branches, it stays quietly inside the carotid sheath, does nothing. It is inside the carotid sheath. Shivangi, this class is for both for the first years and for the NEET PG. It is best attended by those who are themselves in the first year, because this will be, because I am also doing it from a subjective point of view. That you have to name all the branches, right? But it is as useful for NEET PG and FMGE exam. So now let's talk about the what is the feature related to the cervical part. What you have to remember is the carotid sinus and the carotid body that is present at the base of the cervical of the internal carotid artery. Remember that the carotid body is a chemoreceptor, whereas the carotid sinus, it is a baroreceptor, and both are richly innervated by the glossopharyngeal nerves. Right? That is about the carotid sinus and the carotid body. These are the only two things that you remember related to the cervical part. Now, after the cervical part, it enters into the petrous part of the temporal bone. That is known as the petrous part of the internal carotid artery, and that will continue until your foramen lacerum. Here it gives two branches. One is the Vidian artery, right, which is the artery of the pterygoid canal. Artery of the pterygoid canal, right? That is one artery that it can give. Second artery that it gives is the Carotid artery, which goes into the internal. Basically, don't remember what it gives. Only remember that it gives bony branches here. All right, it gives branches in the bone which supply various regions of the bone. Okay. Then cavernous segment. Cavernous segment gives these few branches. One is the meningiohypophyseal artery, right? And meningiohypophyseal artery will help you remember everything. Because it has a few meningeal branches which supply the meningeal walls of the cavernous sinus, which are made out of dura, inner and outer layers. And then it also gives the superior and inferior hypophyseal arteries. The cavernous segment is very important. Why? Because it gives an arterial supply to the superior and inferior hypophyseal artery. And they're very important. Why? Because they supply your pituitary, right? To the hypophysis. So that is why this whole thing is a little important. Cavernous segment. Most important part is the cerebral part, right? So as soon as it leaves the cavernous sinus, it gives a branch that is known as the ophthalmic artery. Very important because it supplies your entire eye and everything. It gives the central artery of the retina also. So the first branch after the cavernous sinus is the ophthalmic, right? And then you have the larger terminal branches, that is the anterior cerebral and the middle cerebral artery. Middle cerebral is the largest. We'll be doing the circle of Willis. Don't worry, iski tension mat lo. The cerebral part we'll be covering in detail. There are communicating segments, that is the PCA and the anterior choroidal artery. Anterior choroidal artery gives the choroid plexus of the inferior horn of the lateral ventricle. We'll just talk about it. Don't worry. Now, before I move to the subclavian system, I want to enlighten you a little about let's do a quick thing where we revise the stuff that we have done. So, okay, I've already revised with you the external carotid artery system. Now, if I were to revise the internal carotid artery system, what are the main learning points that you need to remember? Internal carotid artery, first you need to remember that there are the cervical part, have the petrous part, then you will have the cavernous part, and then you will have the cerebral part. Out of the cervical part, you need to remember that there are no branches. There is carotid sinus, is carotid, right? Petrous part, you only need to remember there are bony branches, one of which is the caricotympanic. Cavernous, you need to remember it is the meningiohypophyseal artery, right? Meningiohypophyseal artery. So it will give the superior and inferior hypophyseals. It will give a few meningeal branches. Cerebral, you need to remember a lot. And besides that, in cerebral, you need to remember that the internal carotid artery will be a major supply. The first artery that it gives here is the ophthalmic artery, which is an artery which gives the central artery of retina. So again, very important. ठीक है, आकाश का मस्त रिवीजन हो रहा है. आई एम ग्लैड यू आर एबल टू राइज एवरीथिंग सो क्लियरली. आई होप ये वाला लेक्चर अच्छा लग रहा होगा. आई स्पेंट अ लॉट ऑफ टाइम मेकिंग दिस. Second, let's move to the subclavian system. Second, let's move to the subclavian. In the subclavian system, you have a few things. You have the subclavian artery, which is divided into three parts by a key muscle. What is the key muscle here? Is the scalenus anterior. Remember, I told you that the lateral pterygoid divides the maxillary artery. The pectoralis spinal divides the axillary artery. The subclavian artery is divided by the scalenus anterior. Important to remember, that is why the relations of the scalenus anterior are also. है तो ये वाला एक डायग्राम सा है, ये देख लो, ये कौन सी मसल जा रही है बड़ी सी. काइंड ऑफ लुक्स लाइक अ लेग पीस टू मी, राइट? दैट इज योर स्केलिनस एंड the part that is present behind the scalenus anterior, that is basically the second part. That is the second part, and so that is how it will be divided. The part that is present proximal here is the first part. अरे यार एक मिनट, ये हो गया तुम्हारा proximal part, ये हो गया तुम्हारा second part, ये हो गया तुम्हारा third. The first part, that is medial to the medial to the scalenus anterior. Second part, posterior to the scalenus anterior. Third part is going to be lateral to the scalenus anterior. So now you know the medial, posterior, and lateral relations of the scalenus anterior. Very simple, right? Now, what are the other things that you should know here is that there is a nerve that is coming down here, that is the vagus nerve. There is another nerve, that is the phrenic nerve. Those are the two nerves that are related here. The vagus nerve is part of the carotid sheath. Part of the carotid sheath is the right common carotid artery. So this was the innominate artery, that is on the, if you talk, this is the right side. The right side you have the innominate artery, which divides into the subclavian artery, right subclavian artery, and the right common carotid artery. The right common carotid artery, it will obviously not give any branches, but then we are to talk about the right subclavian. So you can see one more thing here. If you have a very sharp observation, you will be able to clearly make out that the scalenus anterior is inserting between the subclavian vein and the subclavian vein and the subclavian artery on the, and these two are going on the first rib between the clavicle and the first rib, right? तो इसका orientation बहुत मस्त बना लो, that ये आ रहा तुम्हारा कैलिनस एंटीरियर, ठीक है? और कैलिनस एंटीरियर कहाँ अटैच होगा? फर्स्ट रिब पे. फर्स्ट रिब के ऊपर क्या प्रेजेंट है? क्लैविकल, ठीक है? फर्स्ट रिब के ऊपर प्रेजेंट है क्लैविकल. नाउ इफ आई टेक दिस पॉइंटर, यू हैव टू रिमेंबर दैट यहाँ पीछे से जा रही है subclavian artery, right? In between the clavicle and the first rib. And what else is going? The subclavian vein. Now, where is the subclavian vein going? It is going from the front. It is superficial, right? Because veins are superficial to artery, right? तो बस ये याद रखना, anterior relation में क्या आ जाएगा? Subclavian vein. Posterior relation में subclavian artery. And you have to remember that the subclavian artery is present between the clavicle and the first rib. If there is the formation of a cervical rib, or there is some thoracic inlet syndrome sort of thing, there can be a compression of the subclavian artery before its third part. Okay, and अभी branches की बात करेंगे तो ये first part की branches हैं, ये second part है, यहाँ पे पीछे कुछ branches होंगी और ये third part. So you can make out these branches. This first branch that comes out is the vertebral artery tending upwards. Then you have only one downward branch, that is the internal thoracic artery, and then you have this branch which is known as a thyrocervical trunk. It gives one artery here, and one artery, right? बात करते हैं उसके बारे में. So now I have told you that the first part, नहीं बताया गया. तो vitamin C पता है? Do you know what is vitamin C? Ascorbic acid. I hope you know what is vitamin D. Calciferol. Mnemonic है यहाँ पे भी. Branches of the first part, branches of the second part, of the of branches of the first part are known as vitamin. Second part D, vitamin. Now इसमें से मेरे को बताओ कि कौन सा vitamin रोज खाना पड़ता है? Vitamin C की vitamin D. Vitamin C रोज खाना पड़ता है, right? But vitamin D, it is a fat soluble one, right? So if you don't eat it every day, then also it is fine. So you may or may not eat it. Vitamin C you have to definitely eat almost every day. Okay? So vitamin D, this artery may or may not be present. May or may not be. क्यों होगा वो बताते हैं, right? So there is a logic to this. So the mnemonic here is vitamin C, D, and here you have to remember that the T part here, it is a thyrocervical trunk. So it is further divided into three, and उसका भी mnemonic है हमारे पास, ठीक है? तो एक पता है डी से एक और चीज होती है विटामिन डी के अलावा, ड्रग्स, राइट? एंड अभी मस्त रिया चक्रवर्ती वाला चल रहा है ना, तो डी फॉर ड्रग्स, रिमेम्बर। एंड ड्रग्स से रिलेटेड क्या होती है? स्पेशल इन्वेस्टिगेशन टीम। रिया चक्रवर्ती इज बीइंग इन्वेस्टिगेटेड बाय अ स्पेशल इन्वेस्टिगेशन। तो एस आई टी इज द निमोनिक दैट यू नीड टू नो। पी आई टी, एस आई टी, पी आई टी में टी को डिवाइड करो एस आई टी में, इधर सी और इधर डी। ये V क्या है, C क्या है, D क्या है, ये देखते हैं। V इज बेसिकली योर vertebral, I is your internal thoracic artery, E is your cervical trunk, and when you divide it, I'll tell you what is this SIT. C is your costocervical trunk. Costo means ribs, right? And cervical means neck. D is dorsal scapular. So that is what you need to memorize here. Very easy to do it. Now if I come back here, we'll talk about the thyrocervical trunk. So divided into what I told you is the SI. कैसे याद रखेंगे इसको? SIT. S is the suprascapular artery which takes part in the anastomosis around the scapula. I is the inferior thyroid artery. I is the inferior thyroid artery and T is the transverse cervical artery. ठीक है, इसको ऐसे देखो, ये तुम्हारी निकलती है ऑलरेडी। Look at this, what I'm drawing. An artery that will go downward, that is known as the inferior thyroid artery. Okay, inferior thyroid artery. There is an artery that is transverse, all right, horizontal, almost horizontal. That will be the transverse cervical, right? Now what is it left from F? Oh sorry, ये inferior thyroid ये नहीं है यार, thyroid ऊपर जाएगी, that will be the thyroid artery. What will go down will be the suprascapular artery, either scapula. Right? That is about the inferior thyroid artery, the transverse cervical artery, and the supra. Now the transverse cervical artery, as you can see, it is a horizontal thing here, so it will divide into two. Okay? Divide into it divides here into the superficial and deep branch. Divides into the superficial and deep branch. This was the transverse cervical artery, divides into the superficial and deep branches. Now the superficial branch is always present, right? It is a constant branch. Then there is another branch that is known as the deep branch. Okay, the deep branch may or may not be present. If it is present, then the third part will not give the dorsal scapular artery. Okay, so basically क्या है? Dorsal scapular artery and this deep cervical artery, they essentially have the same functions. They have to do the same thing. Okay, so the dorsal scapular artery says to the second part, to the transverse cervical artery, देख भैया तू है तो मैं जा रही हूँ. Okay, so they are basically दो मियान में एक तलवार नहीं रह सकती, नहीं एक मियान में दो तलवार नहीं रह सकती, right? So it basically means that two arteries have the similar supply, and if one is present the other will not be present. If the other is not present then only the other will be present. ठीक है, अगर ये डीप सर्वाइकल आर्टरी नहीं होती है तब डॉर्सल स्कैपुलर आर्टरी देता है थर्ड पार्ट, otherwise deep cervical artery gives it. The deep cervical artery you can say is essentially the dorsal scapular artery. Okay, right? So the D can either be here or the D can be part of the vitamin C. Deep cervical artery will be absent if you have the dorsal scapular artery, or the dorsal scapular artery will be absent if you have the deep cervical. Now, what does the costo-cervical trunk mean? Costo means that it will supply the intercostal space definitely. So costo-cervical trunk, just all you have to remember, the branch of the second part of the subclavian artery, and you have to know that it supplies the intercostal space, especially the superior most intercostal space, that is the first intercostal. Now let's move to the relations of the scalenus anterior. Very easy to remember if you've understood everything. Okay. Relations इसके important है because ये key muscle है. After doing the relations, we are going to move to MCQ. अरे प्यारे MCQs हैं इसके. एंड 1 घंटे में हमने ऑलमोस्ट सारा ब्लड सप्लाई ऑफ हेड एंड नेक कर डाला है. अभी सर्कल ऑफ विलिस बच रहा है, ठीक है, बट ब्लड सप्लाई ऑफ हेड एंड नेक 1 घंटे में हमने पूरा कर दिया है. ठीक है, विच इज अ मेजर अचीवमेंट अकॉर्डिंग टू मी. उसमें मैंने शुरू में 5 मिनट का प्रमोशन भी कर दिया था, वो मस्त है यार. Like I told you, I will not be wasting your time. So posterior relations, I already told you one, that is the subclavian artery. Now along with the subclavian artery, posteriorly here you will have the trunks of the brachial plexus running. That is the two things that you have to remember: trunks of brachial plexus and subclavian artery. Anteriorly, what will be going? I told you subclavian vein. What else is present? The right common carotid in the carotid sheath along with the vagus nerve, internal jugular vein, and there are a few relations of the carotid sheath itself, that is the ansa cervicalis and the hypoglossal. The carotid sheath will also be there. Then I told you that this nerve that is running in front of the scalenus anterior very prominently, that is the phrenic nerve. And then you have the branches of the thyrocervical trunk. First, the second, the third branch. They will all be going to the scalenus anterior. That is all you need to remember about the relations of the scalenus anterior. Now I hope from this you can also make out a very important relationship of the first rib. ठीक है, first rib वाला भी important होता है. Okay, यहाँ पे just note this. What all is drawn. ठीक है, सबसे पहले posteriorly क्या attach हो रहा है? Let's say this is your first rib, and this is where your scalenus anterior is attaching. So here you will have a tubercle here known as the scalene tubercle. You will have a tubercle on the first rib known as the scalene tubercle. Posterior to that you will have a groove, and anterior to that you will have a groove. This is the groove for the subclavian artery because it is present posterior to the scalenus anterior. Anterior to it you will have the groove for the subclavian. These are the structures that you will have, and they are the ones that are going to be present. Now it's time to move on to the question. Now it's time to move on to the my first question is that thyrocervical trunk is a branch of which part of the subclavian artery? बहुत प्यारा आसान सा question. Thyrocervical trunk is a branch of which part of the subclavian artery? Give me an answer within the next 15 seconds, and then we can move on from this question. I just want to make sure that we start from the basic concept and then we go to a difficulty level that is desired. If you guys have liked the lecture so far, you can subscribe to my Telegram channel at the rate. Akash is saying 1 ka A fastest answer of this correct answer. TIT में T is thyrocervical trunk, it has branches. IT, that's me. Vidushi Agrawal has also given the correct answer. Question number 2. Vertebral artery passes through foramen of transverse process. I have not taught you the vertebral artery yet. I will be doing it today itself. So if you can answer this well and good, otherwise we'll move on. Okay, if you know the answer to the second question, just put it in the chat box. Just write 2 and your answer, and we'll see if you are able to answer it. Otherwise, I'll ये आज cover हो जाएगा पक्का. Jitesh, you are right for the first answer. Two का आंसर हमने D दिया है. You are absolutely correct. All except the seven cervical vertebra. We'll also discuss this. ठीक है. Question number 3 again अभी आया नहीं है, but maybe you can answer question number 3 also if you were able to answer question number 2. Write 3 and your answer number 3. Anil Shah, absolutely. This class is sufficient for right from it is sufficient for anyone, right? If you are hoping to study the blood supplies of the head and neck, the blood supply of the brain and the spine. Class has been made in a very comprehensive way, and we are also going to do MCQs. So you can see that I have covered most of the MCQs of the NEET PG examination, the AIMS examination, and USMLE step 1 usually has conceptual questions, right? It will not ask such direct questions. Vertebral artery transverses all of the following except for the concepts of the USMLE, yes, definitely. Yeah, but uske alawa you have to apply your own neuroanatomy, so it will be more clinical oriented, right? Third का answer is C, intervertebral foramen. Absolutely true, Akash Sinha. Thus pass with this foramen magnum, arachnoid space, and the foramen. Answer C. Question number 4. Wrong statement about the branches of the external carotid artery. Okay. External carotid artery discuss कर लिए हैं. So now you have to tell me the wrong statement. ठीक है. आज के lecture से ये 5 सेकंड भी नहीं लगने चाहिए इस क्वेश्चन को. 5 seconds. ठीक है. Immediately मैंने ये सारी चीजें टक टक फिंगर टिप्स हैं. Question number 4. I told you to remember 8 branches external carotid artery has, and जिस तरीके से मैंने remember करने को बोला था, the way I told you to remember it, that is the way this question has been framed, right? The wrong statement for the branches of the external. और ए आकाश मस्त रिवीजन कर लिया तुमने, तुम तो हरा दोगे सबको. फास्टेस्ट आंसर आकाश. Answer is A. Anterior ethmoidal artery is the branch. Is the wrong statement. Anterior ethmoidal artery is first of all a branch of the internal carotid circulation, right? Comes from the ophthalmic artery, है ना? So maxillary artery is a terminal branch. So I told you to remember कि terminal branches दो हैं. Maxillary artery. I told you to remember medial artery एक है. Ascending pharyngeal artery. Then I told you that how do you remember the anterior branches? You have to remember that the first artery that is coming out is the superior thyroid artery. Then there is a tortuous artery known as the facial artery. Between them you have the lingual artery. Vidushi Agarwal also. Great. Question number. Superior thyroid artery arises from which of these vessels? Superior thyroid, not internal thoracic artery. Inferior thyroid artery. Okay, because ITA can be inferior thyroid artery, can be internal thoracic artery. Very careful when using such words, especially in your notes, right? If, let's say in your notes you write ITA. Now don't get confused that this is the internal thoracic artery. You have to be very careful when you use short forms, you use short language in your notes. That might create a confusion. Always better to spend an extra 2 seconds to write something rather than use short forms which you will not understand yourself later. Anil Shah, obviously you'll get a PDF of this session. You have to join my Telegram channel at the rate NEET Chetanya for that. Yeah. Okay. Question number 5. It is a branch of the thyrocervical trunk. So you know that the branches of the thyrocervical trunk are the special investigation team of Priya Chakrabarti. Okay. That is the answer for question number 6. Exposure of the left subclavian artery by the supraclavicular approach does not require cutting off. This is a question of surgery, but I hope you can answer this from this anatomical answer this based on our anatomical understanding. Because I've not talked about what is the supraclavicular approach, neither do I know about it. Anil Shah, the PDF of this session will be available on my Telegram. And if you guys like the video, please do give me a thumbs up at the video icon and please write if you can at the end of the class after it has stopped live streaming, drop a comment. I will be really thankful to you. Homohyoid. No, that's not the right answer. Homohyoid is not the right answer. So Akash has gone wrong here. Now somebody else needs to step in and give me the right answer. Jitesh is saying C, Scalenus medius. Absolutely correct, Jitesh. Jitesh Radhakrishnan in this round. Scalenus medius. See, this is the scalenus anterior. This is the subclavian vein. This is the subclavian artery going behind it. And even behind it, you have the scalenus. Scalenus medius is not required if you are going with a supraclavicular approach. The supraclavicular approach, what I understand would mean is the clavicle. So this is the supraclavicular area, and you have to approach from here. You have to reach the left subclavian artery. So what all you have to remove? You have to remove the subclavian vein, fractally बढ़ेगी. You will have to remove the scalenus anterior a little. You will not, so, and the sternocleidomastoid is running here, so that might need to be removed. But the scalenus medius is present even behind the subclavian artery. If you're going from anterior, scalenus medius won't need to be exposed. If you're going from posterior, however, scalenus medius might need to be exposed. Question number: which of the following is not a branch of the first part? अरे ये तो ऐसा लग रहा है कि नोट से क्वेश्चन निकल के आ रहे हैं. नोट्स क्वेश्चन से बहुत सिंपल कॉन्सेप्ट लगा दो यहाँ पे. पहला आदमी का है ना, फर्स्ट पार्ट ऑफ द मैक्सिलरी आर्टरी. द मोमेंट यू सी फर्स्ट पार्ट यू राइट पहला. द मोमेंट यू सी मैक्सिलरी आर्टरी यू राइट पहला आदमी से हो जाएगा. 7A, absolutely. Greater Palatine Artery. Greater Palatine Artery is a branch of which part of the maxillary artery? The Greater Palatine Artery, it is a branch of which part of the maxillary artery? So, Admi mein you can see that DMI is already here. Greater Palatine Artery is part of Pig Pass, that is the third part of the maxillary artery. So, the moment you see the first part of the maxillary artery, right Pehla, right Admi, and you will come to your question number 8. Posterior superior alveolar artery is a branch. Posterior superior alveolar. क्या बहुत अच्छा क्वेश्चन नहीं है ये, but you can still probably answer it. Yes, third part. Akash and Vidushi, you are right. It is a branch of the third part. I'm repeating once again. If you guys are liking these sessions, do give me a thumbs up. Motivates me. Matlab thumbs up in the sense, press the like button of the YouTube video and drop a comment after the session is over so that it remains in the record. एट का ए नेजल ब्रांच नहीं, नेजल ब्रांच नहीं होगा वैसे तो. ऑल्दो नेजल ब्रांच और पैलेटल ब्रांच तो स्पेसिफाइड नहीं होता, बट क्वेश्चन ऐसा है तो हाँ, ए नहीं है वैसे. आकाश एंड विदुषी रॉन्ग यार. ये नहीं होगा. देखो मैक्सिलरी आर्टरी की जो नेजल ब्रांच है ना, दैट इज अकॉर्डिंग टू मी दैट इज द स्फीनोपैलेटाइन आर्टरी. इट डज नॉट हैव, बिकॉज स्फीनोपैलेटाइन आर्टरी इज डिफरेंट. पोस्टीरियर सुपीरियर एल्वेओलर आर्टरी है. आकाश सेकंड गेस ठीक है आपका. 8 का आंसर बी हो जाएगा, पैलेटल ब्रांच ऑफ मैक्सिलरी, बिकॉज इट गोज इन द goes inferiorly, right? There is, you have to know that there is nothing known as the mandibular artery, and the inferior alveolar artery cannot give the superior alveolar artery. Obviously, वो inferior है. Inferior का branch कैसे देगी? You can basically exclude that the nasal branch नहीं होगा, mandibular artery नहीं होगा, inferior alveolar artery नहीं होगा, तो बचा. Okay. Now this is something that I have not discussed. Question number 9. What is the subclavian steel syndrome? If you are well aware of this, answer it. नहीं तो tell me that you don't know. So question is, in subclavian steel syndrome, there is a reversal of blood flow in which artery? There is a reversal of blood flow in which artery? Okay. That is your question. Hmm. Contralateral vertebral artery. 9 का लिख रहे हो क्या? Ipsilateral vertebral artery. सनी यादव. अरे वाह. सनी यादव को लगता है पढ़ के आया है सनी यादव आज. Gosh, wrong, not contralateral vertebral artery. Answer is going to be A, ipsilateral vertebral artery. So look at this. This is called as the subclavian steel syndrome, and it is one of my favorite concepts in the gross anatomy, not the neuroanatomy. Neuroanatomy is full of Willis. So see what happens. This is your, what is this artery? The carotid circulation, right? What is this? The subclavian circulation. Subclavian, this is the first part that is giving the vertebral part, vertebral artery. This is the internal thoracic artery going down, and then you can make out that this is the thyrocervical trunk. So this part that is going upward is the vertebral artery. But the two vertebral arteries, they join to form the basilar artery, right? And we'll talk about this. What is the basilar artery? Yeah, uh, the circle of Willis करेंगे. Yeah. So vertebral artery में basically what happens if this subclavian artery gets blocked, right? Proximal to the origin of this vertebral artery. What am I saying? क्या 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 बोल दिया मैंने? ठीक है. देखो यहाँ पे vertebral artery का origin हो रहा है subclavian artery. अगर कोई भी blockage इस vertebral artery के origin से पहले, if there is a blockage of the subclavian artery proximal to the origin of the vertebral artery, then what happens is known as the subclavian stenosis. Why? Because you see that the blood is not able to flow because there is a block here, right? All the blood, it essentially goes to the carotid system, but there is nothing going to the distal part, distal to the block to the subclavian system. So your arm is saying that मेरे को भी कोई खून दे दो. Your this entire part is not getting. Now what we will say that ये जो vertebral artery आ रही थी ना, का एक दूसरा भाई है दूसरी साइड, इज द वर्टिब्रल अदर साइड lateral, उससे खून चुरा लो. ठीक है. Steal the blood from there, bring the blood to me. The subclavian artery is very hungry for that, and it does not realize that it is taking away blood from the brain because that vertebral artery was going to supply the brain. This vertebral artery, right? So you have to see here that this subclavian steal syndrome, you're actually stealing blood from the brain, supplied to the subclavian system, right? Yeah, Jitesh, I'm explaining. Don't worry. So this is the circulation that is going on. So that is known as the subclavian steal syndrome, and because the blood supply is being diverted away from the brain, you will have symptoms like fainting and syncope and everything. And what is the reason? A block in the subclavian artery proximal to the region of the vertebral artery. The subclavian artery says that this vertebral artery should get blood from its other brother from the other side, right? Brother from another brother. Okay? And this vertebral artery will have a reversal of blood flow. Initially, the blood was going like this, but now this blood goes from here. Some is able to go here, the rest is here, and it goes to the subclavian. Okay, understood the subclavian steal syndrome. So the answer will be the ipsilateral vertebral artery. Why? Because if the blockage is in this vertebral artery on the right side, if the blockage is on the vertebral artery of the right side, the reversal of blood flow also occurs on the vertebral artery of the right side. Okay. Now move on to question number 10. Right? What is the first branch of the external carotid artery? Direct question. Notes. Question number 10. What is the first branch of the external carotid? First branch of the external carotid artery is the superior thyroid artery. Absolutely true. This is the first branch of the external. There's an anterior branch also. Question number 11. Common carotid artery divides at the level of. Question number 11. Okay, glad Jitesh. Vidushi, thank you for the answer. Jitesh is also right. Sunny Yadav is also right. All are right for question number 10 that the first branch is the superior thyroid. Question number 11. At what level does the common carotid artery undergo its bifurcation? What level does it undergo its bifurcation? Okay, a lot of you are saying C. Ishika Goel is also saying C. Papa Mithu is also saying. Right. So I told you that it occurs at the superior border of the thyroid cartilage. And what is the vertebral level here? That is the C3, C4. That is the vertebral level at which this bifurcation. Superior border of thyroid cartilage. Now, question number 12. Middle meningeal artery is a direct branch of. Middle meningeal artery is a direct branch of. Very simple question. Two arteries, middle meningeal artery, accessory meningeal artery. Middle meningeal artery enters here. So if this is the artery of which it is a direct branch, it gives a middle meningeal artery here and it gives an accessory meningeal artery. Middle meningeal artery will go through foramen ovale, and what is present posterior to it? Foramen canosum. Sorry. How would So the accessory meningeal will go anteriorly through the foramen ovale, and the middle meningeal will go posteriorly through the foramen. 11 का A नहीं, Ishka, I think you were going to write 12. So 12 का A, right? So it is a direct branch of the external carotid artery? No, wrong. Not a direct branch of the external carotid artery. External carotid artery only has 8 branches, which you are expected to know it in this way: anterior, medial. Yeah, आपने Ishka, you'll need to watch the initial part, and it will be very crystal clear to you that this is not the answer. Terminal, era, posterior. Yeah, so I told you कि external carotid artery की branches के लिए remember that there are two terminal branches, maxillary artery and superficial temporal artery. There are one medial branch, that is ascending pharyngeal artery. For posterior, remember the Mastoid process which divides the posterior auricular artery from the occipital. Three anterior branches is the superior thyroid artery, which is the first branch, and then you have to remember after the superior thyroid artery, you have to remember tortuous artery known as the facial artery in between. 12 का आंसर होगा बी. 12 का आंसर होगा बी, दैट इज द इंटरनल मैक्सिलरी आर्टरी. अब मेरे को ये नहीं पता कि इसने इंटरनल क्यों लिखा है. बता दो इंटरनल का आंसर है मैक्सिलरी, नॉट द सोल्यूशन बोलो. Question 13. So now just take a guess here. What is the most common site of subclavian artery stenosis? Okay. What is the most common site of subclavian artery stenosis? The first part, second part, the most common site where you will have subclavian artery stenosis. Okay, great, Rishika. Right. First part of subclavian artery, yeah. That's why we discussed the subclavian steal syndrome, right? That is why we have to discuss the. That is why we constantly discuss the subclavian steal syndrome. Okay. Subclavian steal syndrome. A हो गया आंसर. वेरी गुड. बस लास्ट इस टॉपिक के दो क्वेश्चन रह गए आई थिंक. देन वील मूव टू द ब्लड सप्लाई ऑफ द ब्रेन एंड स्पाइनल कॉर्ड. वेरी इंपॉर्टेंट गाइज. आई विल रियली अप्रिशिएट कि तुम लाइव देखते रहो ये पूरी वीडियो. बस बता दूंगा ब्लड सप्लाई ऑफ ब्रेन एंड स्पाइनल कॉर्ड भी. So which structure can be felt at the lower part of the medial border of the sternocleidomastoid? Lower part, the medial border of sternocleidomastoid. Sternocleidomastoid ऐसी मसल आ रही है. मीडियल बॉर्डर लोअर पार्ट. यहाँ पे कौन सी फील होगी? यहाँ पे ऑब्वियस है यार. यहाँ पे कौन सी फील होगी? सोचो यहाँ पे कौन सी फील होगी? Not the subclavian artery. Common carotid artery, absolutely. Common carotid artery is what will be palpated here at the medial border of the sternocleidomastoid. Now there is something that you might or might not know. Okay. So now do you know what is the Chesnax tubercle? ये सुना है नाम कभी? Chesnax tubercle. क्या मेरे को स्पेलिंग इसके एग्जैक्ट नहीं पता है. ऐसे से ही कुछ होता है. ठीक है. Chesnax tubercles. Something like that. Right. That is the Chesnax tubercle. It is also known as the carotid tubercle, right? Now, what is the carotid tubercle? Is the anterior tubercle. So, if you know the structure of the cervical vertebra, it has an anterior tubercle. So, it is a modification of the anterior tubercle of the C6, right? 6. Okay, ये याद रखना. Anterior tubercle. And that is where you palpate the common carotid artery. You press the common carotid artery against the carotid tubercle, and that is where you have field palpation. Question number 15. All of the following are branches of the external carotid artery except. So except is important. No? Yeah, I think there are two answers here, or is there one answer here? B, there is all right. Right, so you are all right. Transverse cervical artery is a branch from the subclavian artery. It is a branch of the thyrocervical trunk. Superior thyroid artery, first branch of the external carotid artery. Lingual artery is between the superior thyroid and the facial artery. Ending pharyngeal, only medial branch of the. Now we are done with that. Let's move on to the supply of the brain and blood supply of the spinal cord. I'll also touch upon the blood supply of the posterior capsule. Main what I want you to know is the blood supply of the brain. So tell me if you are confident with the blood supply of the head and neck now. ठीक है. अगर मैं एक तुम्हें छोटा सा और recap दे दूं तो क्या क्या करना है तुम्हें मैं वो बता देता हूँ. बाकी just you can watch the video again. सब मस्त समझ. There is a circulation through the carotid system. There is a circulation to the subclavian. What is the circulation through the carotid system consist of? External carotid artery and the internal carotid. External carotid artery, you have to remember there are 8 branches, out of which 2 are important to know. One is the facial artery, the other is the maxillary artery. Maxillary artery has 6 branches, facial artery has 8 branches divided into the cervical. Facial part divided into the first, second. Internal carotid artery is divided into parts. Cervical part, petrous part, cavernous part, cerebral. Subclavian artery is divided into 1, 2. Chronic here is vitamin C, D. PIT में T में there are further arteries. F also may or may not. Key muscle here in case of subclavian artery is Calenus anterior. Key muscle here in case of maxillary artery is lateral pterygoid. Okay, ये summary clear है? ये summary clear है? Yeah, all right. क्या कुछ यूजफुल लगी क्या वीडियो यार, ये भी बता दो. बता दो यार, कुछ ऐसे अच्छी लगी हो वीडियो, ऐसे मेरे को थोड़ी सी तारीफ मिल जाएगी, थोड़ा बूस्ट मिल जाएगा. ओके, ग्रेट आकाश, थैंक यू. ब्लड सप्लाई ऑफ ब्रेन एंड स्पाइनल कॉर्ड, ये पार्ट मैं थोड़ा ज्यादा ही मस्त पढ़ा देता हूँ, ठीक है. फर्स्ट थिंग दैट यू हैव टू स्टार्ट विद इज द वर्टिब्रल आर्टरी. ठीक है, हमने क्या कवर कर लिया? एक्सटर्नल कैरोटिड, इंटरनल कैरोटिड, सबक्लेवियन. क्या नहीं कवर किया? वर्टिब्रल आर्टरी वो भी कर देंगे, क्या दिक्कत है? हाँ, चार ही तो आर्टरी है. तो वर्टिब्रल आर्टरी की बात करें तो वर्टिब्रल आर्टरी को समझने के लिए उसके चार पार्ट समझना जरूरी है. तो क्योंकि हर पार्ट की अलग अलग ब्रांचेस होती है, तो हर बार आर्टरी को क्या करते हैं? चार में तोड़ते हैं, उसकी ब्रांचेस बनाते हैं, उसके मॉनिटर. So the first part of the vertebral artery, what you have to remember is that it moves from the subclavian artery. It ascends upward and passes through the foramen transversarium of the first six cervical vertebra. What is important? First six cervical vertebra. Okay. First, that is C1 to C6 does not pass through C7. Does not pass through C7. ये important क्यों है भाई? इतना स्ट्रेस क्यों डाल रहा हूँ इसको? जो वर्टिब्रल वेन होती है ना, वो चली जाती है C7 पे, वहाँ पे धोखाबाजी हो जाती है. ठीक है? दोनों चलते साथ हैं. वर्टिब्रल वेन कहती है मैं तो 7 से भी जाऊंगी, वर्टिब्रल आर्टरी कहती है मैं जाऊंगी C1 to C6 pre-foraminal. Then after it has passed through all the foramen transversariums, there is a part that अच्छा सॉरी, ये तो सेकंड पार्ट ऑफ आर्टरी बता दिया मैंने. फोरामिनल पार्ट था, सॉरी सॉरी. There is also pre-foraminal part. So before it enters the foramen, there is this part here. This is the pre-foraminal. Okay. यहाँ तक pre-foraminal part है और यहाँ तक foramen. After it has passed through the transversarium foramen, so after foramen transversarium, till the time it enters into the foramen magnum, this is known as the third part. This is known as the, here is where you have the third part, and after that you have the fourth part. ये रहा third part, ये रहा fourth. Fourth part intracranial part है, बहुत छोटा सा part है, दोनों join करके बेसिलर आर्टरी बना ले. ठीक है. सो वर्टिब्रल आर्टरी की डिविजन्स एक बार थोड़ा तरीके से, क्योंकि मैंने बीच में छोटी सी गलती कर दी थी. लेट्स स्टार्ट अगेन. वर्टिब्रल आर्टरी के पार्ट, ये तुम्हारा स्टार्ट यहाँ से हुई, कहाँ से, सबक्लेवियन आर्टरी के फर्स्ट पार्ट, एंटर करी फोरामेन ट्रांसवर्स एरियम ऑफ C6, असेंड करी C1 तक, ओके, सो C, this is the first part till C6, till here you have the second part, then up to this foramen part, then after the foramen magnum to its merger with the opposite side to form the basal part. Fourth part is the intracranial. Third part is between foramen transverse area to foramen magnum. This is known as the foraminal part, that is important. The foraminal part, that is the first part, right? And it does not pass through the foramen transverse area of the C7, where vertebral vein will definitely pass. So branches are the first part will give only muscular branches here. Second part will give you some spinal branches. Foramen transverse area में जा रहा है, since it's going along the vertebral cord, तो क्यों ना spinal cord को भी branches देगी. Third part will give you muscular branches, and you have to remember that the third part is present in the suboccipital triangle. It is present in the suboccipital triangle. Because it is present in the suboccipital triangle, it will give branches to the muscles that will form the suboccipital triangle. What are those muscles? Splenius capitis, rectus capitis. ठीक है, तो ये बाद में देख लेना कौन सी कहाँ पे है, क्या है. Fourth is that will come from the fourth part. Fourth part से बहुत important branches आती हैं. Anterior spinal artery, posterior spinal artery. Posterior spinal artery may also come from pica. Then it also gives the posterior inferior cerebellar arteries, and then it gives some medullary. तो 5 तरह की branches आ जाएंगी fourth part. So you have to remember first and third are easy, muscular. Second is easy because it is passing through the foramen transverse area. Final branches, fourth is the one that you have to remember. 5 branches: anterior spinal, posterior inferior cerebellar, medullary, and meningeal. What is the blood supply of brain? What is the blood supply of brain? There are two kinds of circulations here. One is the anterior circulation, second is the posterior circulation. The anterior circulation consists of the carotid system and the posterior circulation consists of the vertebral basilar system. अरे ये चीज समझनी बहुत जरूरी है, ये बेस फॉर्म्स है. यहाँ से क्या आ रही है, कैरोटिड, ठीक है, यहाँ से गला दबा दूं तो यहाँ ब्लड नहीं जाएगा, तो ये कौन सा सिस्टम आ रहा है, कैरोटिड सिस्टम. देन पोस्टीरियरली क्या है, वर्टिब्रल कॉलम, उसके साथ कौन सी आर्टरी की बात करी हमने, वर्टिब्रल आर्टरी. सो वर्टिब्रल आर्टरी इज फॉर्मिंग द vertebro-basilar system because the two vertebral arteries they join to form the basilar artery. Now look at this diagram. This is everything. All right, this is diagram is everything. ये diagram is the shit. Right? ये diagram ही याद रखना है. अब इसको हम इससे ना देख के we will try to draw it because I have seen one thing in anatomy. You can draw something, you can remember. Draw something and सेक्सी रेड कलर ले लिया हमने. तो नीचे से क्या आ रही थी, दो आर्टरीज, क्योंकि का नाम है वर्टिब्रल, राइट, राइट एंड लेफ्ट, दोनों ज्वाइन कर रही थी, फॉर्म कर रही थी एक छोटी सी आर्टरी जिसका नाम है बेसिलर आर्टरी. नाम है बेसिलर आर्टरी. नाउ थिंक ऑफ इट दिस वे, ठीक है, ये वर्टिब्रल आर्टरी आई अंदर फोरामेन मैग्नम पे, ब्रेन स्टेम शुरू हो गया है ना. ब्रेन स्टेम में नीचे क्या था, यहाँ पे मेडुला ऑब्लोंगेटा, मेडुला ऑब्लोंगेटा के ऊपर क्या आएगा, पॉन्स. यहाँ पे पॉन्स, ये बेसिकली पॉन्स वाले एरिया में प्रेजेंट है, और यहाँ जो पॉन्स वाला एरिया है ना, देयर इज अ सल्कस फॉर द बेसिलर आर्टरी प्रेजेंट ऑन द एंटीरियर सरफेस, राइट, दिस इज प्रेजेंट देयर. नाउ द बेसिलर आर्टरी एज सून, सो ऊपर मिड ब्रेन आ जाएगा, राइट. देन यू हैव दिस डिविजन ऑफ दिस ट्री इन two posterior cerebral arteries, into two posterior right, posterior. Now what is left, what is left is to talk about the branches in between. ये basic overview हो गया. Now इधर pons है तो basilar artery pons के अंदर से जा रही है, तो pons को blood कैसे नहीं देगी यार. यहाँ पे उसने blood दे दिया through pontine branches, numerous pontine branches to the right. अब कौन सी ब्रांचेस रह रही हैं, भी पहले देखो, ये वर्टिब्रल आर्टरीज जो हैं, they will both each give a branch that will join form the anterior spinal artery, that will form the anterior spinal. Okay. The vertebral arteries, remember, they also give a branch here known as the posterior inferior cerebellar artery, posterior inferior cerebellar artery, commonly known as pica. ठीक है, pica वो भी याद रखना है. Okay. and pica is generally a branch of the vertebral artery. Now the posterior spinal arteries, they can either come directly from posterior inferior cerebellar artery or they can come directly from the vertebral artery. Okay, so most commonly they are from the, मतलब ऐसे मेरे को exact पता नहीं है, but posterior inferior cerebellar से दिखाते हैं ज़्यादा commonly, है ना? तो आई एम नॉट श्योर ऑफ द डेटा. यहाँ से मैं पोस्टीरियर नीचे जा रही है ना, तो पोस्टीरियर स्पाइनल आर्टरी. अब उसके बाद द बेसिलर आर्टरी, इट गिव्स ऑफ अ ब्रांच हियर दैट इज नोन एज द एंटीरियर इंफीरियर सेरिबेलर. ठीक है, पोस्टीरियर इंफीरियर के लिए तो हो गया. अब इंफीरियरली पोस्टीरियर सप्लाई कर दिया तुमने. सी, if this is the pons, the cerebellum is present behind it. So if this is the pons, the cerebellum is present behind it. Now here you had a branch to supply the posterior surface of the cerebellum. Okay. The vertebral arteries give a branch to supply the posterior surface of the cerebellum inferiorly. Now you need a branch to supply the anterior surface of the cerebellum, that is given by the basilar artery. ठीक है, वर्टिब्रल आर्टरी तूने एंटीरियर की नहीं दी तो मैं दे देता हूँ बेसिलर आर्टरी. ठीक है, अब उसके बाद एंटीरियर सप्लाई हो जाएगा तो सुपीरियर भी तो सप्लाई करना है किसी ने. अब सुपीरियर में बेसिलर आर्टरी से मैं इंफीरियर का भी दे दूंगी, एंटीरियर का भी दे दूंगी, पोस्टीरियर का भी दे दूंगी, एक ही ब्रांच दे दूंगी. ठीक है, so it gives a branch here that is known as the superior cerebellar artery. And what was this? Anterior inferior cerebellar artery. And what were these branches? These were the pontine branches. So we have started with the posterior circulation, and this is the vertebro-basilar system giving the anterior spinal, posterior spinal, pica, ica, superior cerebellar arteries, and the posterior cerebral. I hope you know that this is the vertebral and this is the basilar. I don't have to label these two. Okay. Now, one thing that I want to tell you, that the anterior inferior cerebral artery, it gives a branch known as the labyrinthine artery. इसका मैंने MCQ भी डाला था अपने चैनल पे, नीट पीजी चैतन्य @NEET PG चैतन्य सर्च करना टेलीग्राम पे, मेरा चैनल मिल जाएगा. Labyrinthine artery is more commonly a branch of the anterior inferior cerebral artery. 85% of the times, 15% of the times it is a branch of the direct branch of the basilar artery. The option that you have to choose in the question that I had given you. And labyrinthine artery, what is important is that it is an end artery. Labyrinthine artery is an end artery. All right. Now, if you move more superiorly, you will have the internal carotid system. ज़्यादा anteriorly देखोगे. Internal carotid artery ऐसे section में, cross section में ऐसे दिखेगी. ये सब arachnoid space में present है. तो ये internal carotid artery ऐसे ऊपर जा रही है. ठीक है. Internal carotid artery gives two very large branches. One is the anterior cerebral artery. ठीक है, ये कौन सी होगी? Anterior cerebral artery. Then it gives another two very large branches, which are its largest branches, that is the middle cerebral artery. Middle cerebral artery is the largest. Then it gives a few communicating branches. One is the anterior communicating, joins the two anterior cerebral. Anterior communicating. Then it gives a posterior communicating artery. Now, posterior communicating artery does not connect the two posterior cerebral arteries. It connects the internal carotid artery to the posterior cerebral artery. ये याद रखना. Posterior communicating artery, first of all, it is a branch of the internal carotid artery, not a branch of the posterior cerebral artery. It is coming from anterior to posterior, not from posterior to anterior. ठीक है, ये याद रखना. You might get confused here. The posterior communicating. Now with that, you have to remember a few other arteries. One is the anterior choroidal artery. It is a tortuous artery, goes to the plexus, the choroid plexus of the inferior horn of the lateral ventricles, right? And then you also have an artery which is coming from the anterior cerebral artery, which is known as the recurrent artery of Hübner. It also supplies the coronal capsule layer. This is known as the recurrent artery of Hübner. Comes proximal to the anterior communicating. Okay. फिर एक डायरेक्ट branch होती है तुम्हारी middle cerebral की, more commonly, that is known as the lenticulostriate artery, also known as the Charcot's artery of cerebral hemorrhage. Okay, वो सब facts अभी discuss करते हैं एक बार. Let's move on. Just take a screenshot of this if you want to take it, but otherwise ये वाला diagram है. You can see middle cerebral. This is the anterior choroidal. This you can see is the anterior communicating between the two anterior cerebrals, and this is the posterior. ये हो गया anterior system. Posterior system was vertebral arteries giving the picas, giving the anterior spinal arteries. Picas were giving posterior spinal arteries. Then basilar artery, first branch was anterior inferior cerebral artery, which was giving the labyrinthine artery, which is an end artery. Then you had the basilar artery, which runs on the surface of pons, giving pontine branches, dividing into the superior cerebellar and the posterior cerebral arteries. Right? Now remember one thing, that between the superior cerebellar and the posterior cerebral arteries, you have this artery which is known as you have these nerves, which is the oculomotor and the trochlear nerves. Oculomotor and the trochlear. These are two nerves that are present. The anterior cerebral artery in its proximal part gives the recurrent artery of Huebner, right? Here it gives the recurrent artery of Huebner. And the middle cerebral artery gives the Charcot's or the lenticulostriate artery of cerebral hemisphere. Now remember that this anterior choroidal artery, it is known as the artery of cerebral thrombosis. It is known as the artery of cerebral thrombosis. Why it is known in such a way? Because this artery is a very coiled artery, alright? It has a very tortuous face. Okay. It is an commonly, because see this, see the internal carotid artery से आएगा कुछ. It is a very thin artery, it has a very long course, so it is very easy for a clot to get stuck in it. It is known as the artery of cerebral thrombosis. It is known as the artery of cerebral thrombosis. And what is the artery of cerebral hemorrhage? That is the lenticulostriate artery. It is given by the middle cerebral artery. It is also known as the Charcot's artery of cerebral hemorrhage. Also, Charcot's artery of cerebral. So that is a little bit about the basics of the circle of. यहाँ तक समझ आया, यहाँ तक क्लियर है, तो मैं आगे बढ़ूँ. Circle of Willis. Excuse me. सर्कल ऑफ विलिस क्लियर हो गया. एंटीरियर सर्कुलेशन क्या है, पोस्टीरियर सर्कुलेशन क्या है, वर्टिब्रल आर्टरी क्या है, बेसिलर आर्टरी क्या है, पोस्टीरियर सेरिब्रल क्या है, सुपीरियर सेरिबेलर क्या है, एंटीरियर कोरोइडल क्या है, इंटरनल कैरोटिड, एंटीरियर सेरिब्रल, एंटीरियर कम्युनिकेटिंग, पोस्टीरियर कम्युनिकेटिंग. ऑल दीज आर्टरीज, दिस इज अ मस्ट नो. मतलब किसी भी एग्जामिनेशन के लिए ये नहीं पता है तो बहुत गड़बड़ है. सर्कल ऑफ विलिस इज अल्ट्रा इंपॉर्टेंट बिकॉज इट इज द ब्लड सप्लाई ऑफ योर ब्रेन. ये एंजियोग्राफी वगैरह, रेडियो वगैरह में भी काम, एंजियो रेडियो जो भी करते हैं. यस कर दो एक चैट में. Write a yes in the chat. You are clear with what we have done. So, okay. Akash has written a yes. Thank you. चलो आगे बढ़ेंगे. अभी दूसरी ने भी लिख दिया है. Now I'll talk to you about which regions of the cortex are supplied by which artery. Okay. अब now you are clear that anterior cerebral artery कौन सी है, middle cerebral artery कौन सी है, and posterior cerebral. If you look at the medial surface, the major supply comes from the anterior cerebral artery. If you look at the lateral surface, the major supply comes from the middle cerebral artery. Now, why is that? Because the medial cerebral artery, it runs in the lateral sulcus or the sylvian sulcus, or the क्या कहते हैं lateral sulcus of sylvia, something like that. The middle cerebral artery, it runs next to the sulcus and it will supply all the part that surrounds us. Okay. There is a small part on the top that is supplied here by the anterior cerebral artery, because these are the branches that are present keeping onto the lateral surface from the medial part. And there is a large part here of mainly the occipital region that is supplied by the posterior cerebral artery. And you can see that in the medial surface also, medial में large part posteriorly is supplied by the posterior cerebral, anteriorly it is supplied by the anterior cerebral, and there is a very small portion that is supplied by the middle cerebral. And you can clearly appreciate this demarcation. ये देखो posterior cerebral artery का supply ये है, middle cerebral artery का supply ये है, and आगे वाला. These are all the views that will give you an idea that which part of your brain is supplied by what. And if you are clear with your neuroanatomy, you will know which part of the cortex controls what. Accordingly, you can decide if there is a lesion or there is a hemorrhage or there is a thrombosis of a specific artery, what kind of symptoms are to be expected. Now, if you look at this, this will give you a more clear idea. So this is the middle cerebral artery is in blue. It runs in this sulcus. So it will supply this temporal region. It will supply all this middle region. There are a few arteries peeking from the medial surface. This is the frontal part. So there are a few arteries peeping from here. These are the anterior cerebrals, and these are the posterior cerebrals. Thank you. This is the lateral view. This is the medial view. Most of the part is being supplied by all this anterior cerebral portion, and these are the arteries that are peeping towards the lateral side as well. Some part of the lateral side. They'll mainly be supplying the medial parts of the homunculus. And they are the median parts of the homunculus, that is the lower limb and the urination and everything. So the occipital part is supplied mainly by the posterior. Now you're clear with the circle of Willis. You know that the anterior choroidal artery is also called the artery of cerebral thrombosis, supplies the choroid, the inferior horn of the lateral. Now the posterior cerebral artery, it will supply the lateral and the medial geniculate bodies, thalamus. Along with that, it will supply the visual cortex. It is important to remember it is supplying the visual cortex. Also remember that the part that of the visual cortex that represents the macula is also supplied by the middle cerebral artery. The macula is often spared if there is a thrombosis of the posterior cerebral artery. You will have vision loss, right? You will have contralateral homonymous hemianopia with macular sparing. Why? Because the part that was being supplied by the posterior cerebral artery to the part in the visual cortex that represents the macula, it is spared because it also receives the supply from the middle cerebral artery. The middle cerebral artery can compensate. Okay. तो ये पार्ट हो गया पोस्टीरियर सेरिब्रल आर्टरी का, ये हो गया एंटीरियर कोरोइडल आर्टरी का. ये पाइका का एक चीज है that it supplies the cerebellum and it also supplies the choroid plexus of the fourth ventricle as it is present in close to the cerebellum. अब ये डायग्राम बहुत इंपॉर्टेंट है, याद रखना. क्यों? क्योंकि ये ओरिएंटेशन दे रहा है तुम्हें that exactly how is the circle of Willis present on the actual surface of the brain. How is it actually present on the surface of the brain? And important beauty thing is that it also shows where all the cranial nerves are present. It also shows where all the cranial nerves are present. So as you can make out, these two things, these are the middle cerebral arteries. They will go into the lateral circle. That is why this region was being supplied by the middle cerebral artery. This you can see, these are the anterior cerebrals going forward. So obviously this part will be supplied by the anterior cerebral artery. And these are the posterior cerebrals going backward. So this part will be supplied by the posterior cerebral. Okay. That is the first thing that needs to be cleared in your head. Anterior cerebral, middle cerebral, posterior cerebral. Okay. Out of which posterior cerebral comes from vertebrobasilar system. The anterior cerebral and the middle cerebral come from the internal carotid or the carotid system. Right? First thing. Second things you have to see. Let's go in a sequential manner. Let's tick everything to make sure that we know everything. Olfactory bulb and olfactory tract. I hope you know that they are coming from the olfactory lobe. They're going to the olfactory lobe. Then you have the corpus callosum that will be present in the center, separating the left and the right. Optic nerve will be forming a chiasma here, somewhere here. So this is optic nerve forming a chiasma. The internal carotid artery emerging from this, giving the middle cerebral artery. Also, you know the side lobe is known as the temporal lobe. You will have the posterior cerebral artery right? This is a bifurcation of the basilar artery, and there is a bifurcation proximal to it, that is the superior cerebellar artery. In between the superior cerebellar artery and the posterior cerebellar arteries, you will have the oculomotor nerve and the trochlear nerve. Abducent nerve will come, 6th, 7th, 8th will come from the ponto cerebello CP angle, or they will come from the uh, separation between the pontomedullary junction, right? So the abducent, the facial, and the vestibulocochlear nerve are to be expected from there. The glossopharyngeal nerve, the vagus nerve, and the spinal accessory, they all come out from the lateral surface of the medulla. The hypoglossal nerve comes from between the pyramidal nerve. Done this brainstem section very clearly. Then what is left? Hi, Kabir Mukhi. Hi, Kabir Mukhi. Frontal lobe आगे आ गया. Then you have the anterior cerebral artery का supply going here in the lateral portion. Anterior communicating artery present between the anterior cerebrals. Then middle cerebral artery तो पता ही है, anterior cerebral artery भी पता है. Posterior communicating artery पता है, it will connect the internal carotid system to the posterior cerebrals. Trigeminal nerve coming out of pons. Basilar artery lying on the sulcus of pons. Labyrinthine artery, which should be coming as a branch of the anterior inferior cerebellar artery, but they've shown it as a direct branch here from the basilar artery. Anterior inferior and posterior inferior cerebellar arteries, you can make out this is the pica, this is the ica, and vertebral artery तो दिख ही रही है. Anterior spinal artery is coming from their junction going, and posterior spinal arteries will be coming from inferior. ठीक है. 7 o'clock तक हमने देखो सब कंफर्म कर दिया है, सब कंफर्म कर दिया है ना. So basically, if you are watching the theory, if you are here for the theory bits, this is the part till where you should watch. If you are here for the MCQs as well and you want to strengthen even further, watch this last one where we'll be summarizing this concept after the end of these MCQs of circle of Willis. Okay. I will also be talking a little bit the supply of the blood supply of the internal capsule as well as the blood supply of the spinal cord. हाँ, तो दोनों चीज़ों की बात कर लेंगे and this will become a comprehensive lecture for future record for blood supply of head and neck, brain, spinal cord, internal capsule. ठीक है. Let's move ahead. Yeah. Any comments? Spinal cord. Almost been 2 hours. So let's talk about the various MCQs here. Question number 1. What is the primary motor area? Area number 4 of the brain supplied by. Area number 4 of the brain. Primary motor area. Area number. तो आगे होता है there is a central sulcus which divides the motor and the sensory regions. The primary motor area is the one that is being talked about here. Area number 4. Area number 6 is the secondary motor area, and then you also have the supplementary motor area. These are the three areas that are related to motor. And similarly, this is the primary somatosensory cortex. You also have the secondary. Okay. So can anybody answer question 1? Primary motor area, area number 4, is supplied by which of the following cerebral artery? The options are anterior cerebral, middle cerebral, and middle cerebral. I have no replies. So, but anyway, I'll continue. किसी ने question का answer नहीं दिया है लगता है. Either enough people are not watching or nobody knows the answer to this. I'll just wait one more minute in case you guys are watching and you don't know the answer. Please write don't know, I don't know or something to make me assume that I can go for. Go ahead. Yeah. So I'll just tell you that the median part. So if this is your brain and this is your medial portion, this is your lateral portion. Let's say this is the cerebral hemisphere. So this medial part will be supplied by so there are the anterior cerebral artery is coming till here. This part is supplied by the anterior cerebral artery, and this remaining the lateral part is supplied by the medial cerebral. So it is supplied by both the anterior and middle cerebrals. Number one, the answer is question number two. Which of the following is not a branch of the cavernous segment of the internal carotid artery? Which of the following? Very good. Kabir Mukhi has given the answer finally. One answer is C. Question number two. Which of the following is not a branch of the cavernous segment of internal? Not a branch of the cavernous segment, the internal carotid. Okay. So question number two, can anybody tell me an answer which is not branch of the cavernous segment? It has been asked twice, one in the All India PG and one in the AIMS North. The inferior hypophyseal artery, Kabir Mukhi has given the answer as A. I'll tell you that is the wrong answer. Why? Because I told you that the cavernous segment gives the branches which are the meningo-hypophyseal branches, right? So it has to obviously it has to give meningeal branches and it has to give the superior and inferior hypophyseal branches, right? So obviously the answer cannot be A. A is the wrong answer. Now, if anybody else can enlighten me with the right answer here, that will be really great. So you have branches to the cavernous sinus. You can think of it in this way that branches to cavernous sinus will obviously arise from the cavernous segment. Now I told you that the meningeal artery, so meningeal branches are also here. The only option that remains is the ophthalmic artery. And I told you that ophthalmic artery is the first part that comes out after the internal carotid artery leaves the leaves the cavernous sinus. Leaves the cavernous sinus. That is the first branch comes out. So answer will be ophthalmic. Question number three. Which of the following is not affected in a posterior cerebral artery? Which of the following is not affected? See, right, striate cortex, no. Striate cortex is affected. See, understand this anatomy 3D atlas and Kabir Mukhi, that striate cortex will be affected in posterior cerebral artery. Yes, you are right that the macular part will not be affected, but the rest of the part of the striate cortex will get affected, right? The macular part also receives supply from the middle cerebral artery. So the answer is not D. The correct answer here is B. Why? Because the pons receives its main supply the basilar artery, because the basilar artery has a lot of pontine branches. It has a lot of pontine branches. So it does not need the posterior cerebral artery. Basilar artery, it divides into the posterior cerebral artery. Now before its division only, here you have a lot of pontine branches. So even if you have an infarct here, let's say you have an infarct here, the blood supply to this region is still intact. The answer here, the answer here will be pons. The answer will be pons. Anatomy 3D atlas. Nothing happened. I was just telling you that macular sparing will not be the right answer for a simple reason that uh, posterior cerebral artery infarct will still affect the striate cortex, even though it will leave out the part that is responsible for macular vision. Okay. Question number 4. All of the following arteries supply the medulla except. All of the following arteries supply the medulla except. You have to know the blood supply of the medulla for this. And if you have a general orientation of how the circle of Venus is oriented, you can almost guess which region will have blood supply from which artery. Right? Since I just told you that the basal artery lies on the surface of pons, so obviously blood supply of pons is mainly through the basal artery. Small bit from the vertebral arteries also because they're present below, right? So that is how you have to remember which area has what kind of a blood supply. The blood supply of the brain is extremely crucial to know. Your brain is extremely crucial to know because that is how your a lot of medicine, a lot of infarcts, a lot of drug administrations, a lot of things has to be done through that. Anatomy 3D Atlas is saying the answer is C, posterior cerebral arteries. So should I trust Anatomy 3D Atlas and assume that he has given the right answer? Yes, absolutely. Vidushi has also confirmed that the answer is superior cerebellar artery. Why? Because see, this was your vertebral arteries. Was your vertebral arteries. They were giving your basilar artery, right? And they were this was dividing into the posterior cerebral artery and the superior cerebellar artery, right? So, but the medulla is present somewhere below. यहाँ पे pons आ गया, ऊपर the midbrain है. So medulla is present below. So it cannot be supplied by the superior cerebellar artery because it is very distant from where the medulla is present, right? Obviously, answer will be C. You can see the anterior spinal artery will be present here. Anterior inferior cerebellar artery will be given at this level. Basilar artery will also be present. So they can supply the medulla, but the superior cerebellar artery cannot at all supply the medulla. Question number 5 is another question. All of the following arteries supply the medulla except. Again, so medullary supply is important. And there are two syndromes related to the medulla also. You should know lateral medullary syndrome and medial medullary syndrome. Lateral one is also called as. Can somebody tell me what is lateral medullary syndrome also known as? Tell me what is lateral medullary syndrome known as, and also tell me what is medial medullary syndrome known as. I'll give you a hint. This starts from W, this starts from D. Western Digital. Yes, so this is known as Wallenberg syndrome, right, Vidushi? Rightly said. And this is known as Dejerine syndrome. Okay. ये ज़्यादा पूछा जाता है. Lateral Wallenberg syndrome is more commonly asked, especially in your prof examination. Wallenberg syndrome is the lateral medullary syndrome, right? Vinita Sri. What about the medial medullary syndrome? Yes, Dejerine, right. Faisal Ahmed Khan, very good. Dejerian's anterior bulbar syndrome. अच्छे से विश्राम सिंह पढ़ी है. Faisal Ahmed Khan. Right. So now tell me the answer to question number 5. आसान question है यार, question number 5. You know that there is nothing known as the bulbar artery. So answer will be bulbar artery. Like I told you in the previous question, posterior inferior cerebellar artery, basilar artery, the anterior spinal artery. Who supplies it? There is nothing known as the bulbar artery. The answer will be bulbar artery. You are right. Lateral medullary syndrome is Wallenberg syndrome. Lateral medullary syndrome. Tejerine's anterior bulbar will mainly affect the posterior lateral part. That will mainly affect the anterior medulla, and according to that, you will have different symptoms. And I want you to go through those symptoms once and understand how they happen. You will be able to do that if you have a clear knowledge of the arrangement of the fibers and the tracts inside the medulla. Question number 6, which is not a branch of the vertebral artery. Vertebral artery has 4 parts. 1, 2, 3. The first part. Tell me the answer to question 6 and then I will tell you what I was explaining here. Answer to question number, which is not a branch of the vertebral artery. Aika. Yes, absolutely correct. Fazi is right. Again, this anterior inferior cerebellar artery. Why? Because this artery, anterior spinal artery, it is a branch of vertebral artery always, right? Posterior spinal artery, it may be a branch of the vertebral artery or it may be a branch of the pica. But since it is also a branch of the vertebral artery, we'll wait. Posterior inferior cerebellar artery, yes, it is a branch of vertebral artery. Now, anterior inferior cerebellar artery, no. This is a branch of the basilar artery. The branch of the basilar artery. And the labyrinthine artery, which is, again, I keep emphasizing on the labyrinthine artery because it is an end artery, so it can either come from this. Yes, the branch of the basilar artery. Right, Vidushi is also right. Answer is D. The first part has muscular branches. Third part also has muscular branches to the suboccipital triangle. Then the second part, as you know, has spinal branches. Why? Because it is the foraminal part running in this foramen transversarium of the first 6 cervical vertebra. The fourth part has 5 branches: anterior spinal artery, posterior spinal artery, posterior inferior cerebellar artery, pharyngeal branches, and one more which I don't remember. चलें एक बार दिखा दें. Hmm. That is the medullary. There are some medullary branches directly from the vertebral artery, right? So these are the five branches that you need to remember. Let's move to question 7. There's a block in the posterior cerebral artery supplying the occipital lobe. What does it cause? If this is the brain and you have the anteriors here, the middles here, the posteriors here, there is a block in, let's say, the right posterior cerebral artery, supplies the occipital lobe. What does it result in? What does it result in? Right. Qazi, what I skipped earlier, what I didn't remember initially was medullary. Vertebral artery has anterior spinal, posterior spinal, medullary branches, meningeal branches, and posterior vertebral artery. Five branches of the fourth part of the vertebral artery. Third part gives muscular branches. The first part also gives muscular branches. Part owing to its nature of running in the foramen transverse vertebral column will give. So guys, I have some exciting to kya? There's something to tell you all that there will now be a national importance combined entrance test known as the INIET for admission to the PG. So it is going to be a combined exam for New Delhi, for JIPMER, for NIMHANS, and for PGIMR, Chandigarh, that is from where I am. And you will have the other aims also included in this. You will have this central examination which is being conducted by AIMS Delhi for AIMS, PGI, and NIMHANS. All the central institutes will now have a single entrance examination for the year 2021. That is what has been proposed. For Hmm. Absolutely correct, Pasi. You're right. It is contralateral homonymous hemianopia with macular sparing. Now, why does this? So you know why it is contralateral? Because if there is an infarct in the right posterior cerebral artery, the right occipital lobe will be affected, and that is supplying the left eye. That is a contralateral homonymous. Homonymous means complete, and hemianopia, right? So hemianopia, right, means half eye is gone and half vision is gone, and then you have macular sparing. So will be kind of like macular. So that is why does the macular sparing occur? Why? Because the middle cerebral artery will compensate. The middle cerebral artery matlab it's kind of an exception here, that in the occipital lobe it receives its supply from the posterior cerebral artery. The posterior part, the posterior one third, is the region that is responsible for the vision of the macula, and that receives blood supply from the middle cerebral plus the posterior cerebral artery. Even if you remove this, you will still have the circulation from the middle cerebral artery. Question number 8. Most common site of berry aneurysm. Now, berry aneurysm is the cause for subarachnoid hemorrhage, and in the circle of Willis, which is the most common cause. This is the hexagon or the circle of Willis. Anterior communicating artery. Here, anterior communicating anterior cerebral artery. Anterior. What is the answer to this? Most common site of berry aneurysm. Even if you don't know, please write in the chat that you don't know so that I can move faster, right? Because otherwise I know that there are people online and maybe might be solving. I don't want to give out the answer and spoil the fun there. This is a circle of Willis. You can see that this is the anterior communicating artery. This is the anterior cerebral artery. This is the internal carotid artery. This is the posterior communicating, and this is the posterior cerebral artery. My Telegram channel, if you want the PDF for this session, you can join me there. Subscribe to that. The most common site of the berry aneurysm is the anterior cerebral. The answer is B, anterior cerebral circulation. About 45 to 65% of all berry aneurysms are in the anterior communicating artery itself. So yes, right. So this is the right. Good guess, Fezzi. This is the anterior cerebral, most common site of berry aneurysm. They are abnormal dilatations, small, and they rupture and they cause subarachnoid hemorrhage. Most commonly lesioned nerve in intracranial aneurysm. You can answer this based on our cranial nerves class also. I had a class on cranial nerves where I took two classes and उसमें सब मैंने R से बताया था 1 to 7 बताया था part 1 में, and cranial nerves number 8 to 12 was in part 2, and part 1 also had your all of this columns, special visceral efferent, general visceral efferent. So that is also another high yield class. So classes, two for cranial nerves, one for arterial system. These are main classes that you should definitely watch of mine so far. I'm planning some more innovative classes, some more interesting concepts. देखते हैं how to go about stuff. Question number 9. I'm waiting for an answer from your end. And, thank you, Dr. Manoj Kumar Tiwari. I will remember your words. No. Faizi, कोई बात नहीं. If you haven't watched that video, the answer is a trochlear because it has the largest intracranial. You're right. The trochlear has the largest intracranial course. I hope you remember the largest intradural course, the abducent, right? What is the largest interosseous course? Maybe I had told in that video only. These are the three things. Now I have to tell you two things here. That the oculomotor nerve is the answer. The correct answer is the oculomotor nerve. Why? Because it is present in the interpeduncular fossa, where you have the circle villus, right? It is present in the interpeduncular fossa, and that is why it is most commonly lesioned in the intracranial aneurysms, right? The abducent nerve is most commonly injured in increased intracranial pressures. Why? Because there is an apex of the temporal bone over which you have a Dorellos canal, and this nerve takes a very sharp turn over here. It takes a very sharp turn over here, so that is why it gets pressed against this apex of the temporal bone. It is part of the temporal. The abducent is most commonly damaged when there is an increased intracranial pressure. Most common lesion in intracranial aneurysms, whenever something ruptures, is the oculomotor. Why? Because it is present in the interpeduncular vessels. Question number 10. Perianeurysm of the posterior communicating artery may cause compression oxygen. Posterior communicating artery, this is your cerebellar artery. I hope you can make out the structures here. In case anybody of you is planning to use a plus subscription or buy a plus subscription, please do use my referral code. It will mean something, and I will definitely try to pass on some of the books to you. Also take the iconic subscription where you also get Unacademy Plus and you about. Yes, oculomotor nerve, that's right. Why? Because you can see here that the oculomotor nerve is very closely present to the. So I think there's some lag with your answers. I can see now that it is. Yes, yes. Sorry, Fazi. मेरे को आपका oculomotor अभी दिखाया है. I just saw that you have written sir answer please. ठीक है. So this is the oculomotor nerve. This is the trochlear nerve, and they are present between the posterior cerebral arteries and the superior cerebellar arteries, right? So that is why since the posterior communicating artery is very closely related to the oculomotor nerve, dilatations of the posterior cerebral, superior cerebellar arteries, and the posterior communicating arteries can cause the compression of the oculomotor. Right? Answer is B. Sorry for the delay. There's some lag when it because I'm reading the chat on my phone and there's some lag with which it shows here. Perhaps a slow mobile connection. I'll try to connect it to my Wi-Fi. Question number 11, Fazi. I hope you can tell me the answer here. What is true about the branches of the internal carotid artery? So I'll try to move a little faster now. Branches of internal carotid artery. You should know that in the cerebral part you have the anterior choroidal artery. Ophthalmic artery is given as a branch, right? Posterior communicating artery is not given in the petrous part. The carotid artery is given in the. This artery is also given in the cerebral part, so this is wrong. The answer here will be question number 12. Posterior communicating artery is a branch of. Communicating artery is a branch of. So see, this is where they have confused you. All true except yes. That is the question. Now I hope you can read this question. Posterior is my photo overlapping this? Is my webcam overlapping the question? Razi? Sorry. Uh, you can answer question 12. Posterior communicating artery is a branch of. Okay, okay. Well, I'm in the last one. So can you tell me the answer for question 12, Fasi? Other than absolutely. So don't get confused if you have an option here called the posterior cerebral. You will think that हाँ कुछ तो ऐसा ही था ये posterior cerebral ऊपर जा रही है posterior communicating ये right. Branch of the internal carotid, not of the posterior cerebral. ठीक है? Already talked about this in posterior communicating artery aneurysm, which structure may be compressed. Answer will be oculomotor nerve. Right? Aneurysms, remember, mostly oculomotor nerve gets damaged very early. Increased intracranial pressure, you will have UCL. Question number 14. Vertebral arteries of both sides they unite to form. Vertebral arteries of both sides they unite to form what? Again, question 14 is an easy question. Both side vertebral arteries they unite something. Also unite here. That's not uniting per se because they give a branch. Right, basilar artery. That's true. The basilar artery that is formed and have the question number 15. Branch of the basilar artery include. Which of the following is a branch of the basilar artery? Of the following, the branch of the basilar artery. Question from PGI Chandigarh examination. Question, but still a nice question from the circular course. Posterior cerebral artery. True. Posterior cerebral, superior cerebellar, and anterior inferior cerebral arteries. What are the branches of basilar artery? Main branches: posterior cerebral artery, superior cerebellar artery, anterior cerebellar artery, and we have the PCA supplies all except what does it not supply? This question has been asked in a different way previously. Which of the following will not be affected in posterior cerebral artery infarct? Posterior cerebral artery supplies all except Pons, right? Because pons is supplied by the basilar artery. Question 17. Visual area of cortex is supplied by visual area of cortex. Visual area. Oh, sorry यार. Uh, मेरे को अब आया है मैसेज फैजी का. Posterior cerebral artery is the correct answer. Visual area of the cortex is going to be supplied by that. Also remember that there is, you already know about macular sparing. Macular sparing, you also have a branch from the region of the visual cortex that is behind the. Uh, कुछ तेज चलता हूँ मैं. Question number 18. I'll take two questions together ताकि जल्दी जल्दी हो जाए. Question number 18 बताओ पहले. Arteries supplying the occipital cortex is R. PCA, MCA, MCA plus PCA is. Okay. Question is same as the previous one. So I will choose option C. Why? Because macular region is supplied by MCA. The rest is supplied by PCA. So MCA plus the correct answer. Question number 19. Which of the following does not supply? Which of the following does not supply the medulla oblongata? Similar question we've already seen previously. That anterior spinal artery, posterior spinal artery, and posterior inferior cerebral artery. These will supply medulla oblongata, but superior cerebellar artery, it is present very distally, so it will not be able to supply the medulla. So answer is D for question 19. Question number 20. Major supply of the medial surface of the cerebral hemisphere. This I will want you to tell me. What is the major supply of the medial surface of the cerebral hemisphere? Question number 20 is our next question. Anterior cerebral artery, that's correct. The answer is anterior cerebral artery, major supply of the medial surface. Major supply of the lateral surface, supply of lateral surface will be cerebral artery. So yeah, that's number 21. Question number 21. See, NEET 2012 December, major supply of medial surface. NEET 2013 21, lateral surface. Answer is middle cerebral artery, no brainer. Question 22. Circle of Willis does not get contribution. From which of the following arteries does circle of Willis not get a contribution? Right, Faz. Question number 22, very easy. Basics of the circle of Willis and the main for fence. Middle cerebral artery, right? Middle cerebral artery, even though it is the largest branch of the internal carotid artery in the cerebral portion, largest branch of ICA in the cerebral region, and still it does not give a branch to the circle of Willis. All right. Number posterior communicating artery connects? What does the posterior communicating NEET pattern 2015? Will to answer this? Right. Posterior cerebral artery with the internal carotid artery. That's true. The cerebral artery communicates with the internal carotid artery via the posterior communicating. Right. So it is a remember posterior communicating artery is a branch of the internal carotid artery. It is not a branch of the posterior, well, the branch of the internal. Last question for today, question number 24. Identify the marked artery in the diagram. A marked artery. I don't know if you can make out. I can make out what this is. But what this is, first of all, the internal carotid artery. Or what this is, middle cerebral. Identify the marked artery in the diagram. 24, last question, after which we will move to the blood supply of internal capsule. I'll talk a little bit about the blood supply of the spinal cord, although I would recommend that you read it from a textbook. Answer is B, posterior coronary artery. Absolutely too fuzzy. You have a very good knack here in uh, this blood supply portion. I think that you are very comfortable. Watch the cranial nerves video, and if you haven't watched the initial part of today's video, watch that. Can subscribe to my Telegram channel. Danya. Stay connected. Have a discussion. Once we are done with this, now we'll move to an MCQ marathon. Probably doing 3 classes, 150 questions of head and neck, so that you are very thorough with the entire head and neck. Helps you in the viva, helps you in your exams. And one more thing I wanted to say is that let's finish with the internal capsule and the spinal cord. I'll give you an overview here. Basically, that's my entire purpose. And after that, we'll be ending the class. And Fazi, if you like the class, please do drop a comment after this video has finished streaming, so that it remains on record. So now let's talk a little bit about the blood supply of the internal capsule and blood supply of the spinal cord. Blood supply of internal capsule, this is the only diagram that you have to do, and it simplifies everything. So as you know, the internal capsule, it is divided into all these parts. An anterior limb, there is a genu, right? There is a posterior limb, and here posteriorly you have a retrolentiform and a sublentiform. Basically, you have 5 parts of the. They're all supplied different. What is important is the supply of the posterior limb, whose main supply is coming from artery, right? This is the what all has been shown. This is the anterior cerebral. This is the posterior communicating. This is the anterior choroidal. So this is the middle cerebral. Posterior limb receives its main supply from the middle cerebral artery. Now the internal carotid artery gives directly a branch to the genu, which also receives a branch from the recurrent artery of Hubner. So I told you that there is a recurrent artery of Hubner coming from the anterior cerebral artery proximal to the origin of the anterior communicating artery. Anterior communicating artery से पहले recurrent artery of Hubner आई, उसने divide किया, anterior limb भी supply कर दिया, genu भी supply. ये हो गई. Anterior communicating artery से कोई मतलब नहीं है, anterior cerebral artery से कोई मतलब नहीं है, posterior communicating artery से कोई मतलब नहीं. The posterior cerebral artery, it supplies the sublentiform and the retrolentiform part of the internal capsule. Clear? Then if you talk about the middle cerebral, I have already told about these branches, internal carotid artery. So now you are familiar with the entire blood supply also, and now you should know that which fibers are passing from where.
From the posterior limb, you have some fibers which go from the anterior two-third. You have some fibers which go from the uh, posterior limb. Infarctions will have a lot of effect. They're the main damaging infarctions here of the internal capsule. Reason being, internal capsule, all the fibers of the cortex of the radiations, they are concentrated here, right? Because of that, any damage here will affect a lot of muscle fibers together. That is why this place is so important. Yeah. Spinal cord has remained untouched. Spinal cord का मैं थोड़ा सा बता दूंगा, but mainly you should read it from Mr. Ramsing. It's given very good there. So this is your vertebral arteries joining to form the basilar artery. This gives the anterior spinal artery. These give the posterior inferior vertebral artery. So both the vertebral arteries give a small branch. Two branches they join to form the anterior spinal artery. The vertebral arteries give a branch known as the posterior inferior cerebellar artery, and it usually gives the posterior spinal artery, which can also come directly from the vertebral artery. There are two posterior spinal arteries, and you will realize that this runs in the anteromedial fissure, and these two posterior spinal arteries they run the posterolateral sulcus. Besides that, they get branches from the vertebral artery, lumbar arteries, internal thoracic arteries, and they have a lot of branches coming in, in which the T11 is important, which is known as the arteria radicularis magna. Okay, ये वाली artery एक important होती है इसमें segmental arteries, right? So you have segmental arteries, you have anterior spinal arteries, you have posterior spinal arteries, and this is the main supply of the spinal cord. ठीक है, venous drainage भी है उसका कुछ कुछ. So today we have talked mainly about the arterial blood supply of the head and neck. We have not covered the venous supply of the head and neck because of the simple reason that वो थोड़ा different है, right? But with these all concepts, you should be able to answer a lot of questions, and it is relatively more important too, what I feel. Yeah. So that is about this much, and that's about today's lecture. So hit the bell icon if you want to get notifications here. Do subscribe to the channel. Use my referral code Chetanya10 and you will get a 10% discount straight away. Use credits to get another 10%, and if you do use my referral code for any subscription at all, I will make sure that some of my perks are passed on. And what else was I saying? हाँ, so I hope you like today's lecture, and अगर अच्छा लगा ना, अभी स्ट्रीम एंड करूँगा, ये वीडियो सेव हो जाएगी, उसमें नीचे कमेंट सेक्शन में जाके कुछ अच्छा सा कमेंट लिख देना. That will really motivate me. So that's about this slideshow. If you want, I can give you a quick summary. I'll just give you a quick summary of everything that we did. If there are any doubts, please put them. I can answer those as well. Azi, any doubts, or anyone else who's watching, if you have any doubts, please do let me know. I'll be happy to answer here as well. Right. So talking about the blood supply of the head and neck was our main task. Supply the Subclavian system and the carotid. Carotid, we had the common carotid dividing into the internal and external of the superior thyroid artery. External carotid artery, we said, has 8 branches are present. They are present, right, out of which 2 are terminal. Remember all these branches, just look at this table. Axillary superficial temporal artery, only ascending pharyngeal branch. The only medial branch is ascending pharyngeal. Posterior, you have to remember the mastoid process artery. The anterior portion is the thyroid artery, artery, and first artery that is given in this. We go into the details of the maxillary arteries. Maxillary arteries are guided by a key muscle known as the lateral. I have told you in the morning. First part, पहला आदमी, पहला represents first part. He is the names of all the branches. Then second part is the muscular mastication part. Is the branches to the muscles of the medial pterygoid, lateral pterygoid, temporalis, and accessory known as buccal. Third part will give you branches which are can be said to be a mnemonic. Pig pass. Pig pass you can remember. Remember, ascending pharyngeal artery is a direct branch of the external carotid artery, as the pharyngeal artery is a branch of the maxillary. Facial artery has two parts, cervical part and facial. Cervical part will have four branches, which is by a mnemonic STAG, STA. Part also has four branches: superior labial, inferior labial, lateral nasal, and the angular one. The superior labial further gives a branch known as the septal branch to the nasal septum, right? And the angular one, it anastomoses with the dorsal nasal. The site of anastomosis is between the external and the internal. Venous drainage, I told you, two important communications of the Mystery vein. One is the superior ophthalmic vein. Second is the deep facial vein, which is a communication via pterygoid venous plexus. Retromandibular vein, this W-shaped arrangement is very important. I have explained it. The internal carotid artery cervical part does not give any branches. Petrous part is until the foramen lacrum, which is the begin and the carotid. Remember bony branches. Can remember carotid artery. Cavernous segment, remember meningohypophyseal. Meningeal branches will be given the superior and inferior hypophyseal artery. Cerebral part will give the first branch after the Cavernous sinus, that will be called the ophthalmic artery. Two terminal branches, the middle and interior cerebral. Two communicating branches, the posterior communicating and the anterior choroidal arteries. Anterior choroidal arteries are also known as the artery of cerebral thrombus. Why? Because of their long and narrow course, and they are also called. They also supply the choroid plexus of the inferior horn of the lateral ventricle. Then we come to the subclavian system. Subclavian artery is divided by three parts into muscle here, known as the scalenus here, which three parts are vitamin C, D. That's the mnemonic here. Vit C, D. VIT is vertebral artery, internal thoracic artery, thyrocervical trunk. Thyrocervical trunk has three arteries further. IT special investigation team. Suprascapular artery, inferior thyroid artery, and transverse. Transverse cervical artery is divided. The deep is absent. The third part will give the dorsal cervical. Second part gives the costocervical trunk. Costocervical trunk is first. There are a few relations of the scalenus anterior. You have the anterior relations, you have the posterior. Anterior relations will have the phrenic nerve running, the carotid sheath, which will have the common carotid and the vagus nerve with the jugular vein. And there are some relations of the carotid sheath also, like the ansa cervicalis. Then you will have the subclavian vein running anteriorly, the subclavian artery runs posteriorly, and the branches of the thyrocervical trunk, SIT, they will run anterior to the scalenus anterior. Posteriorly, you will have the trunks of the brachial. Then we did a few MCQs. You can see MCQ. And I talked here about the subclavian steal syndrome. Okay, a very interesting phenomena. Blood supply of the brain and spinal cord. Essentially, the first third part, fourth part. Divisions. So the first and the third part give muscular branches. Second part gives spinal. Fourth part will give a few. There is an anterior circulation. There is a posterior circulation. Anterior circulation is the posterior circulation. The vertebral. The diagram of the cerebellus, very important. Anterior cerebral artery will give an artery known as the recurrent arterial tubular, and the middle cerebral artery gives the lenticulostriate arteries. They are also known as the Charcot's arteries of cerebral hemorrhage because they're most commonly involved in intracerebral. Yeah. Then you have the middle cerebral and the anterior cerebral arteries, and they have the following supply on the. Yeah. Now, this is a diagram of the brainstem that you are kind of expecting. So, additional readings I told you to read the blood supply of the internal capsule, which I've given you a very lucid diagram, able to help you remember everything. Just draw it once. Yeah, that helps to create better connection. That is what I've been stressing on while teaching anatomy. That if you can draw it, you can remember. Okay. And blood supply of the spinal cord, I told you mainly artery coming, posterior spinal artery coming from the posterior inferior cerebral artery, also be coming from the vertebral, and the segmental arteries, which branches at the lumbar level, from the internal thoracic artery, from the vertebral artery itself. And the main artery there is at the level of the T11, which is the arteria radicularis, right, which is the largest segment. That's about today's class, guys. To use my plus referral code, and I would say that take iconics, also get better. Use my referral code. you are able to, if you can ask me, I'll also tell you how to use credit so that you can get a 20% off. So that's about this. Let's start ending this itself. Um, like, if there are any questions, then let me know. Otherwise, I'll just end the stream. I'll wait for one more minute. Let's end it at 8 o'clock.